Ended.
Good evening and welcome back to tonight's City Council meeting. Council members are attending this meeting remotely by video conference. Tonight's meeting is available to the public on Channel 8 and through live streaming on Broomfield's website. Public participation is encouraged by calling 855-695-3744 and pressing *3 to be placed in the queue for comment. Please note, if you would like to speak on more than one item on tonight's agenda, you will need to press *3 each time to be placed back in the queue for comment. Public comment will be taken on agenda items following staff presentations. Screeners will ask callers for their first and last name, neighborhood, and the agenda item that the caller would like to comment on. Please call several minutes before the agenda item and press *3 to ensure you are in the queue for comment. Public comment will also be taken during the public comment section for subjects that are not on tonight's agenda. All public comments will be limited to 3 minutes. Again, the number is 855-695-3744 and press *3 to be placed in the queue. The City Council meeting is called to order. Will the clerk please call the roll?
Anderson.
Here.
Castriata.
Here.
Groom. Hinkle.
Here.
Jezierski.
Here.
Law Evans.
Here.
Lim.
Here.
Lindstedt.
Here.
Schaff.
Here.
Tessier.
Here.
A quorum is present. Will everyone please rise and join me for the Pledge of Allegiance? I pledge allegiance
to the flag of the United States of America
and
to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
In an effort to keep tonight's order for tonight's meeting, I ask council to utilize the video conferencing tools to raise their hand for comment when making a motion or a second. I will call on the first hand raised to state the motion and the second raised to make the second as appropriate. I ask council members to limit their comments to 5 minutes. Abby will be assisting with the timekeeping and will provide council members with a notification via video conferencing chat when 1 minute remains. Please ensure you are on the mute when not speaking. If a council member needs to leave the meeting, please inform me before doing so. We will plan on a 10-minute break at approximately 8 p.m. We will begin with council's review and approval of this evening's agenda. Council may add or remove items from the consent agenda, or council may revise the order of business for the meeting. Does any member of the council have any additional comments or questions regarding this evening's agenda? Councilmember Law Evans.
Thank you, Mr. Mayor. So looking at the consent agenda, there's two, I don't mean to prolong our meeting tonight, but there's two issues that I'd like to get a little more information on, have a staff summary. Items 7B is in beta. I'm sorry, 7C. The Tech 84 body scanner. I'd like more information on that. And then 7D, the two ordinances. Oh, I'm sorry. Those are first reading. Never mind. I'll just go with 7C. And if possible, could we just keep that at the top of, well, after the consent agenda instead of putting it back at the end of the agenda?
So does anybody have an objection to move that to the first business item, the tech scanner? Raise your hand if you have an objection. Otherwise, we'll go ahead and move the tech scanner. Jennifer, would you be prepared to make a staff presentation on that?
Yes, sir, we will.
Okay. So we will go ahead and move 7C to the first item, of the business agenda. Okay. Any other questions or comments on the agenda? So we'll go ahead and move on. I'm going to make a note here. Okay, so there are no petitions and communications this evening. We will move to public comment next. This is an opportunity for the public to comment on matters other than the agenda items already listed on this evening's agenda. To be placed in the queue for comment, please call 855-695-3744 and press *3. Public comments will be limited to 3 minutes. Okay, we do have one person on, but they want to talk about 11C. I don't see anybody else. So we will, Guyleen, is anybody in the queue, or Mayor Pro Tem, anybody in the queue? Trying to be in the queue?
No, just the person for 11C, Mayor.
Okay, so we'll move to community and event updates are next. Does any member of council have an update this evening? Okay. And I'll go ahead and move on. I did want to make a comment about simply from the point of view that that we made a contribution this week through the Metro Mayor's Caucus. I wanted to share with council that the Metro Denver Homeless Initiative reached out to Broomfield about contributing to the Housing Stability Flexibility Fund, which assists households who are experiencing a housing crisis by removing financial barriers that prevent them from obtaining or remaining in permanent housing. MDHI provides assistance in Broomfield County. We're able to contribute to the fund again this year, as we have done for the several years. The fund was, the amount of contribution was $1,000, but I wanted to mention that to council because it was through the Metro Mayor's Caucus. Gene, Councilmember Lamp, I think. Who has their hand raised?
Mayor, this is Councilmember Groom. I just wanted to let you guys know I am on the phone, so I might not be coming across as my regular number.
Okay. So Councilmember Groom has joined the phone call. Councilmember Schaaf.
Thank you, Mayor. I just wanted to point out tomorrow is Veterans Day. This is a special day for my kids and I. Every year since they were babies, we've attended the Veterans Day celebration at the Broomfield High School auditorium and celebrated with the Broomfield Veterans Memorial Museum. This year it's a little bit different, but just encourage everybody to continue to celebrate our veterans and celebrate Veterans Day with our local museum. Thanks.
Thank you. I'm going to go ahead. I do have one public comment. I'm going to go ahead and identify Jackie. Jackie, state your name, your name, full name for the record, and your neighborhood. And it says here that you have a general public comment, not a specific agenda item. You've been in correspondence with council, so on a specific agenda item. But go ahead, Jackie. You have 3 minutes.
Yes, sir. My name is Jacqueline McGlashan, and I'm a 19-year resident of Country Estates, and I'd like to thank you, Mayor and Council, for taking my call. I saw a bumper sticker the other day that read, "Speak out for what is right, even if your voice shakes." So here I go, and this isn't an agenda item. But because I dared to ask a question of you, Mr. Mayor, and those on council, if you had any relationship with the 3 candidates you selected for the city and county attorney position, I received the following email from Councilmember Hinkle, and I quote, "I don't find your inquiries appropriate considering an easy internet search to see who you work with, and the same easy internet search could be used to find your answers. I find these emails as an attempt to intimidate our hiring process and will not tolerate it. Also, our attorney works for the council, not you or any high donors attempting to influence local campaigns which failed. Everything you need to know about my connections with any of our attorney candidates can be found online, ... for all the people in the back. Tell Steve Reynolds I say hello, Heidi," end quote. Because I dared to ask a question, my character and integrity were challenged. For Ms. Hinkle to insinuate that these were not my own thoughts is about the most sexist comment I have ever received. Ms. Hinkle's response was totally inappropriate and actually quite dysfunctional. Because I dared to ask a question, I was described as intimidating. Council members Law, Evans, and Groom were not intimidated by my questions and responded in a timely manner. They were the only ones to reply, and I appreciate them taking the time. Because I dared to ask a question, my employer was insulted again. For the record, I work for Mr. Steve Reynolds, a 60-year resident and supporter of the Broomfield community. But most alarming and of great concern to me, because I dared to ask a question, I have been threatened by a member of council. I will continue to ask questions, and I dare every resident and Broomfield employee to pay attention and ask questions, even if their voice shakes. Thank you all very much.
Thank you. We'll move on to is there any other comments from the council?
You mean general comment?
I'm talking about I've lost my place. We were
Community and event update?
Yeah, yes,
Okay.
I lost my place.
Okay.
Are there any other community and event updates? Okay, so let's move on to the consent agenda. Following the clerk's reading of consent agenda items 7A, 7B, 7D, 7E, and 7F, we will ask for public comments. Will the clerk please read agenda items 7A, 7B, 7D, 7E, and 7F by title?
7A, approval of minutes from the regular meeting of October 27th, 2020. 7B, resolution number 2020-249, authorizing and approving an agreement with Harris Systems USA, Inc. for cloud software maintenance and support services. 7D, ordinance number 2140, amending section 13-2-010 of the Broomfield Municipal Code to change the monthly water service charges, first reading. And ordinance number 2141, amending section 13-12-020 of the Broomfield Municipal Code to change the monthly sewer service charges, first reading. 7E, resolution number 2020-255, authorizing and approving an agreement by and between the City and County of Broomfield and Mueller Engineering, Inc. for the Sienna Pump Station and Pipeline Preliminary Design Report. And 7F, resolution number 2020-227, approving an agreement by and between the City and County of Broomfield and Turnkey Health Clinics, LLC, for inmate health care services.
Okay. We will now proceed with public comments. Does any member of the public have comments on these agenda items? Please press *3 and state your first and last name and neighborhood for the record. I'm not noting any comments. Does any member of council have any comments or questions on this agenda item? Councilmember Schaaf?
Thank you, Mayor. So this is concerning agenda item 7F, the agreement with Turnkey Health for inmate health care. It may have been this last month. It could have been 2 months. I've kind of lost track of time during this COVID period. I should say I lose track of the time during this COVID period many times. But we took a tour of I got to take a tour of the detention center, as many of you council members did as well. And one of the places that I had gone that I hadn't gone before was the inmate healthcare section of the detention center. There I got to learn from many of the staff that work there at the detention center about why this is a crucial service for our inmates as well as our staff there at the detention center. So I just wanted to say that I fully support this. I fully support that we continue to provide health care at our detention center. And I have reached out to the chief to start discussing about the possibility of adding dental care to the detention center as well. And I hope at some point that we can continue that conversation because that is one area that is lacking in our detention center and would really ensure that when our inmates are released, that they're released in a very healthy way. That's all I have. Thanks, Mayor.
Thank you. Okay. So any other questions or comments? Is there a motion to, is there a motion that the recommendations contained in the staff reports for agenda items 7A, 7B, 7D, 7E, and 7F be approved? Councilmember Schaaf?
So moved.
Councilmember Law Evans?
Second.
Will the clerk please call, or is there any further discussion? Will the clerk please call the roll?
Anderson,
Yes.
Castriata,
Yes.
Groom,
Yes.
Tinkle,
Yes.
Jezierski,
Yes.
Law Evans,
Yes.
Lim,
Yes.
Lindstedt,
Yes.
Schaaf,
Yes.
Tessier.
Yes.
It passes unanimously. And so we'll move on to, there is no business tonight before the Board of Social Services. This evening, we have one item for the Board of Health, the COVID-19 update. The meeting of the Board of Health is called to order. I'll ask the clerk to call the roll.
Anderson,
Here.
Castriata,
Here.
Groom,
Here. Here.
Tinkle,
Here.
Jezierski,
Here.
Law Evans,
Here.
Lim,
Here.
Lindstedt,
Here.
Schaaf,
Here.
Tessier.
Here.
A quorum is present. Board members have a copy of the agenda memorandum, which staff will summarize. You also got the presentation today. So
Thank you, Mayor. And for this, Director of Public Health, Jason Volling. Jason?
Yeah, good evening, Mayor Pro Tem, and council members. It's a pleasure to be in front of you again today to provide an update on our COVID situation. This is very timely given what's happening in the state and the Denver metro region. You have a memorandum in front of you that outlines a lot of the topics that I'll cover, but I wanted to specifically go through this presentation and hit some of the key points. So if we could go to the next slide. So just as a reminder, Broomfield was categorized into level orange, that used to be referred to level 3 by the state on November 26th. And the reason for this is they have specific thresholds that they're monitoring. One is our 2-week case incidence rate. That's how much the virus is circulating in the county. We are obviously, and I'm going to go into this later, beyond orange in that specific metric. Our percent positivity, and this looks at whether there is sufficient COVID testing to capture the level of virus transmission. And in level orange, the threshold is no greater than 15%. And then finally, impact on hospitalizations and whether we're seeing a increasing, stable, or declining hospitalizations over a 14-day period. So if we could go to the next slide. So I wanted to talk a little about Colorado daily case counts. So we've surpassed the March levels of our cases. And the first thing this chart shows you is the positive cases that have been identified through tests. In March, we know we had way more cases than we could checked because there wasn't enough tests available. We estimated back in that time we had 10 times as many cases as we were testing. But as we started to form contracts with private countries and scaling testing around May and June, we ramped up our testing. And what we're seeing is as we're looking at the level of virus, it is significantly increasing in the state of Colorado. So next slide. And Broomfield's daily case counts continue to rise, similar with the metro region. What you can see is how quickly and significantly our 3-day and 7-day moving averages of cases have gone up. And this is extremely concerning to us. When we were in the late summer, early fall months, we were averaging between 3 to 8 cases. Now we're up to average 3-day average of around 25 cases. And then what that means is we definitely do suspect that there's community level transmission happening. And so if you go to the next slide. And to further indicate this, this just shows the levels that are according to the state dial. Our 2-week case incidence on 11/7 was 494.6. As of today, it went up to 500.3. But back on 11/7, that was equivalent to 350 cases in the past 2 weeks. Just by comparison, there were a total of 350 total cases from March 19th to July 12th. So you can see how significantly this has been doubling and increasing in our community. And on October 24th, the 2-week case incidence was 223 cases per 100,000. Obviously, where we're at now is a 120% increase from October 24th to November 7th. Next slide. Additionally, we're seeing that our 2-week percent positivity rate is going up. And we were well below that 5% threshold for a significant period of time. But as we've seen cases going up, we've seen our level of positivity go up. And the reason that this measure is so important is if you have sufficient testing, which there is indicators that we do have available testing in the community, but you're still seeing your level of percent positivity going up. That's a good indicator that you're again seeing community level transmission. And we haven't exceeded the level yellow or level orange thresholds yet, but I can tell you that the entire state is extremely concerned about the percent positivity that we're seeing. Next slide. So one thing I really wanted to highlight is the fact that most of our counties, actually, this is not just a Broomfield phenomenon. This is happening in the vast majority of the state, but specifically in the Denver metro region and along the Front Range. And we're seeing our most high 2-week case incidence rates, specifically in the Denver metro region. And so that's concerning for us because we know with increased cases leads to increased hospitalizations, which then leads to discussions we're going to have later about hospital capacity. So 53 counties are in local mitigation efforts. We're one of those counties. I'll talk about our efforts later. And again, 28 counties are within the stay-at-home levels of incidence. And I got to tell you that when we looked at this framework as a state, we were fairly conservative of what that threshold should be to go into stay-at-home. And so it's extremely concerning to see what's happening. Next slide. So this slide can be a little bit confusing, but this chart also shows the predicted number of cases according to hospitalizations. So we can more readily measure the number of hospitalizations because they are not dependent on testing capacity. Note the different scales on each vertical axis. Cases, left axis, are scaled per 100,000, whereas hospitalizations, right axis, are not. We know that based on these projections, we've already exceeded our April peak of hospitalizations. And also important to note is the red dotted lines represent our hospitalizations peak back in the spring and our ICU bed capacity. And when you look at the slide, what's most concerning to me is we're quickly approaching, or I believe we've surpassed now that hospital peak that we had. And the next step is looking at our hospital capacity and ICU capacity and ability to manage that. Next slide. So we often hear, is this just a young adult phenomenon? And should we really be looking at mitigation efforts that impact the entire population? Well, that was somewhat true when we saw early on the cases in Boulder and other communities, Denver, and even here in Broomfield with that 20 to 39-year-old age group. What you can see now is that we're having cases rise in all age groups. Even more concerning, though, when you look at this data, is the fact that our hospitalizations are also rising in all age groups. What's concerning to us is to see the hospitalizations in the 65 plus, because we know some of the significant outcomes that can happen as a result of that specific age group being hospitalized. But it's also surprising to see the trending line with our 40 to 64-year-old age group and the level of hospitalizations occurring there. Next slide. And this is not unique, again, to just the state. Broomfield is part of the North Central region. And the reason that we look at the North Central region data versus just Broomfield hospital data is because we're all reliant on the hospital system in the Denver metro area. And what you can see from this slide is that we look at the total number of hospitalizations, those confirmed cases that were hospitalized from COVID, and those persons under investigation that have been hospitalized. What you can see again is that we're quickly approaching where we were back in April and May. We've heard from our North Central region partners that ICU bed capacity is at 82.5%. And ventilator capacity is at 25%. The ICU bed capacity is one measure that we're continuing to look at, and that's a measure that we're seeing as being impacted. Ventilator occupancy, not so much. But the more important issue I really want to focus on, and we're hearing this directly, and we heard it on our town hall, is when we have community-wide transmission, our hospital systems are extremely worried about staffing, and the staffing projected to hit critical levels in the next week. So what that means is they could have shortages in staffing in the hospital system due to quarantines, and also just due to the shifts, how much they are working. Also, primary shortage areas are ICU critical care nurses. That's what we're hearing the most. And only 18% of staffed ICU beds are currently available. So as we go through this, I think it's important for us also to realize that the North Central region does not only accept patients from the Denver metro region, they have patients that are transferred in from counties across the state, and we're also having patients transferred in from counties or other states. So when we look at, well, we could just increase our hospital staffing capacity, all of our states are going through this, which will make it extremely difficult. Next slide. One thing that the School of Public Health puts out is looking at what is our modeling estimate of when we could potentially exceed ICU bed capacity. And again, they use that count of 1,800. This model shows that we can potentially exceed ICU hospital bed capacity in late December. And the reason for that is due to the fact that we're seeing less transmission control happening in our community. Some of that's due to COVID fatigue. Some of it is due to lack of mask wearing. Some of it is due to less social distancing that's occurring in certain populations. And the thing that we're really concerned about, especially with the holiday season coming up, is if we see additional spikes to where we're at in this baseline. And so you can see with that 10% reduction or the 20% reduction where that puts us with ICU bed capacity. There also has been some information shared from the School of Public Health that we could even breach ICU bed capacity in early December. And that's why the governor and others are encouraging people to limit their interactions only to household members, and with holiday gatherings, specifically Thanksgiving, trying to keep those very limited as well. Next slide. So what does level orange mean? We've put a lot of this guidance out to our sectors. Our communications team has been amazing sharing this information out through all of our media channels. Our economic vitality group has been heavily involved in reaching out to sectors to say, what does the shift to level orange mean? And you can see what it is specifically on this. One thing that I do want to note is specifically with schools. And schools were the one area where we were really hoping and trying to keep community transmission down because we knew the importance of keeping kids in school. The Adams 12 has decided to go fully remote. And Boulder Valley School District is discussing with their Board of Education tonight the possibility of switching to remote as well. So obviously, as we see high community level transmission, it impacts our ability to effectively operate schools. Next slide. So what are we doing? We've been doing these mitigation strategies over the last 3 weeks. One is promoting our Reverse the Trend campaign. This has been very successful and being run out of our communications department. A second thing, and I think it was Councilmember Evans brought this up last time, is having people sign up for the Colorado Exposure Notification app. The reason that's so important is if you have your Bluetooth on and you're around somebody that tests positive, there's an exchange of tokens. And from there, you can be notified that you were around somebody that was positive, and then it gives you the steps that you need to take to eventually either isolate or go get tested. And then we're amplifying the governor's message. During this time, it's absolutely critical. We only interact with people in your household through November, that you keep that 6 feet of safe distance and treat everyone like they have COVID-19. They've said in the Denver area, you could estimate that 1 in 100 people have COVID-19. So if you think throughout your day how many people you may be interacting with, the idea is to treat everyone like they may have it. And then most importantly, as we've talked about, is wearing masks. We have increased the number of people tested through our HHS clinic by almost 100 people over the past 2 weeks. We're working as quickly as possible around the clock to add a second testing day in December. And then we're partnering with CDPHE to increase testing access at healthcare provider settings and at long-term care facilities. With epidemiology, we continue to look at epi trends and data, but I gotta tell you, with the epi trends, we're finding that it's harder and harder to pinpoint where those specific sources are of where people have been exposed, just due to that community transmission. We're working with CDPHE to implement technology solutions that will streamline our contact tracing, both internally, but with other health departments across the state. And then we're redeploying public health staff to assist with our additional caseload and contact tracing. And then finally, with enforcement and compliance, we're taking a very proactive compliance checks approach in addition to our complaint-based approach, just to go out and see what's happening in the community. And then, as I mentioned before, developing that sector-specific outreach. Next slide. So the key takeaways, the epidemic has significantly worsened the past few weeks, and especially in the past few days. And we're seeing it in the metro region and in Broomfield. Infection risk is increasing in at-risk populations. That's absolutely what we didn't want to get back to. Unfortunately, we're there. We're entering the holiday season with a surge, as I mentioned before. So holiday travel will be riskier than travel over the summer. And contacts among people not in the same household should be minimized. We need to protect our older family members and friends as we go through this period of high community transmission. And then we are going to continually closely monitor the data and the impact of the mitigation strategies that we're having during the next 2 weeks. Hopefully we could see us begin to flatten that curve or even start to reverse the curve, both in case counts and our percent positivity. But I got to share with you, similar to where we were at back in March, April, and May, is at a point when you are beyond your testing capacity and beyond your epi capacity with community spread, that's when we have to start looking at some of our other levers and some of those policy levers. And I just wanted to share some of the other policy options that are being explored in the Denver metro region. We know 2 counties have enacted curfews. We didn't feel, based on the evidence and also based on the will of our community to have another order like that made sense for Broomfield. A second thing is Denver and Adams County are limiting alcohol sales to 10 p.m., not only in bars with last call, but also in grocery stores and liquor stores. We're not seeing as much of that as far as people that are going to restaurants and then hitting the liquor store and going home. But if we do see more of that would obviously impact our decision. Some counties are looking at canceling recreational sports or limiting spectators at youth sports. And other counties are looking at reducing indoor and outdoor gathering sizes. And our communications team has really developed as I mentioned, the Reverse the Trend campaign and No Spread November, which you can see through all of our social media channels. And last slide. So you can always find more information on broomfield.org COVID. This has all of our latest up-to-date data, information about testing sites. We're really promoting, again, the phone app that Colorado has out there to stop the spread. And then we have our Broomfield weekly scorecard that anybody can review and see where we're specifically at to be as transparent as possible. And with that, that concludes my presentation.
Thank you. So we'll go to public comments. If there's anyone who would like to be heard, please press *3. State your first and last name and neighborhood for the record. I'm not noting anybody specifically that's here for this item. So I will keep my eye on it. Mayor Pro Tem will as well. I'll go to questions from the board. Are there any questions from the board? Raise your hand. Board Member Law Evans.
Thank you, Chair. Jason, thank you for this update, as concerning as it is. I wanted to share a couple of thoughts. I had to recently wipe everything off my phone and reinstall everything. It was a really fun process, but I did have to re-enable the COVID exposure notifications. So if anybody else has that, please remember to do that. And as I said last time we discussed this, I know that there are people who consider this to be an invasion of privacy or something like that, but you're already being tracked by the virtue of having a smartphone. Just go ahead and do it, because at least this is tracking for a noble cause to try and keep people, yourself included, myself included, healthy, as opposed to just tracking you to sell you more stuff. I would also note that I watched Church Online again last week, or I think this was a week ago's message. And this is the mental health implications of this continue to be huge. At my church, Flatirons Community Church in Lafayette, Pastor Jim noted that in the past 3 months, they've done 9 funerals for suicides. So let's all continue to try and be kind to each other. And certainly I need to remember that as much as anyone, and help your neighbors when you can. Any little virtual communication, sometimes reaching out will help a lot. So we are, as Councilmember Tessier is fond of saying, we are all in this together, and we're not done yet. Just because we've got good information on the vaccine doesn't mean we have a road to go through. Jason, I did have one question. When I look at the national map of where the virus is most prevalent right now, Colorado, strangely enough, is not one of the worst states. Kind of the upper Midwest tends to be, right now they're having incidence rates of 1,000 per 100,000 in Wisconsin and places like that. But it does seem to be, to my untutored eye, it looks like it's clustered in that upper Midwest kind of cold plains region is how I think of it. Do we know, is it just random that this is happening in places where it's cold and dry right now? Or is there an epidemiological impetus behind that, and why Florida and Arizona are not seeing these things spike right now, such as the upper Midwest is? Any thoughts on that?
Yeah, I appreciate that question, Councilmember Law Evans. Actually, I just received some new data to show that Colorado is moving in the top 25% as far as hospitalizations and caseloads. So we're definitely trending in the wrong direction. We've heard the situation in the Midwest, and this is happening primarily, I believe Colorado is 3 to 4 weeks behind some of these other northern states that obviously were moving indoors sooner. There's other factors that could obviously come into play with some of those states. But what we're seeing specifically in Utah, we've seen this in North Dakota. We're also starting to hear about this in Nebraska, is the idea of having to pull back on elective surgeries due to the overwhelming hospital demand. And you know, we've always said our North Star is we don't want to be back to that point, that those people that do need care, if you were going in, like such as my dad, who has heart disease and needs to get care, and unfortunately, I never hope this happens, but had another heart attack, and we have beds full, what that would mean. So this isn't just those people that have COVID that are impacting ICU bed capacity, it impacts us all.
Indeed. Thank you for that. I'll just share one other brief anecdote. My stepmother, who is a native New Zealander, goes home back to New Zealand for the holidays most years. And this year, she had to go through a whole extra process. She's leaving in about 2.5, 3 weeks. She'll have to get a COVID test when she leaves, get on the plane, get there. And then in New Zealand, they're having everyone quarantined for 2 weeks in a hotel paid for by the government. So she'll be, you know, home with her family and whatnot, but won't be able to see them for 2 weeks. So I guess when you're an island, literally, you can handle things differently, but Colorado's not in that position. So thank you very much for all your hard work, Jason. Prayers for your dad too. Thank you.
Councilmember Jaworski.
Thank you. And to continue with that anecdote, Councilmember Levens, even if I wanted to, New York is requiring a 2-week quarantine for people that are coming from out of states, and that's where my immediate family is from. So even if I wanted to go back to New York for the holidays, I probably aren't going to be, unfortunately. So anyways, Jason, thank you for the presentation. Very informative as usual. As you know, like my kids are in the Adams 12 schools. My youngest daughter was very bummed yesterday, or it might have been 2 days ago now, that she found out the schools were, you know, her school was being closed down. But I get it though. I mean, they were starting to get some cases there. They had been lucky for the first month or so, but I think they had 3 or 4 cases in the last week or two. So disappointing, but is what it is, I guess, at this point. A couple of questions I have. I saw some snippets from Polis's last, our governor's last briefing on this. He seemed to be a little more positive if on the hospital situation. Is it better in the rest of the state than it is up here in the north? Or did I interpret that wrong?
Yeah, he was talking about the ability to look at standing up alternate care sites. While that's good because it does expand hospital capacity, one of the challenges with that is the level of care that can be delivered in those alternate care sites. And so I also did notice that he was a little bit more positive about that, but everything that I've heard from those individuals in the hospital system goes back to what I was sharing before, that just a level of concern of, even if we were able to stand up those alternate care sites, do we have the ability to bring in qualified personnel to actually staff them?
Okay, so I think that makes sense. I mean, we may have the sites, but the level of care may not be the same as if they were in an actual hospital. So, okay, I get that. One thing that did surprise me was his very much positivity regarding a possible vaccine. And I think he mentioned by the end of the year possible. So I was shocked to hear that. That'd be great if it's true. I was wondering if you have any comments. Is that realistic or not from what you're hearing?
Yeah, so obviously the governor is optimistic about this. What I'm hearing from leading scientists across the nation, Dr. Fauci and others, they're very optimistic. It still has to go through the final FDA approval and emergency use authorization. That being said, if it does past that, Colorado does anticipate that we could start to receive our first vaccine doses in late December, and from there start vaccinating our tier 1 groups, which includes healthcare professionals, first responders, And as we get more and more vaccines, being able to go down to our tier 2 and tier 3, the full hope would be by March and April, we would be able to do broader vaccination in the community. And I think the one thing that we are a little bit excited about with this is the partnership specifically with the pharmacies and the providers. So instead of having it shipped directly to local public health or state public health to get out, they're doing the distribution directly to those pharmacy centers, which could speed up the process and make sure that we get people vaccinated.
So I think that's great. And I was, it sounds like you think that that's a realistic timeline. I get that nothing is for sure in this world, but I know 2 months goes by really fast. So when I heard that, I was like, whoa, it's way sooner than I was expecting to get that ball rolling. But I'm happy to hear that that's a possibility, at least. It's a realistic possibility. So that's awesome. I think it's awesome that we're working towards the increased testing. We talked about that last time, and I hope we're able to get that extra day in there starting in December. And the last comment I want to make, and this is with that app, which I haven't had a chance to do now, and I could say that there's a little bit of a concern for me. It's not a privacy concern, but it's sort of the concern. It's because it's my understanding that if you just brush by somebody in public, your chances of catching COVID is really slim. The real risk, and I think you've mentioned this before, and I've seen this written, the real risk is that long-term indoor setting. If you're sitting with your family or other friends, or hopefully not a restaurant, but the indoor setting, long-term up to 15 minutes, is where the real risk is. So I guess my concern is that I get the app, I brush by somebody, I get a notification, that's when I start panicking and not knowing at all, where the context of the exposure, and it may have been very brief and very innocent, and the likelihood of me being sick from it are probably super small. Yet it's going to cause me to panic. That's why I'm a little concerned about that. So I don't know where. I get there a lot. Maybe the positives outweigh those type of negatives, but that's how I'm feeling about that one. It's like I don't want to be panicking if I'm getting dings every day.
Yeah, Councilmember Jazerski, let me verify that when they exchange those tokens, if it's for a certain period of time or if it's just a brief interaction, because I think that obviously would address your question.
So yeah, I appreciate that, because I don't know if you have something to say, Deb, on that as well.
I'm sorry, this is Deb Fetterspell, Deputy Public Health Director. I was just going to confirm that the app does have the ability to record cumulative 15-minute interaction. So if you just walk by someone, you're not going to get that notification. You have to have accumulated that 15-minute duration. So. Okay, well
that's good to know, because right, I mean, that way I know if I did get a ding, okay, that's real, that's serious, and I should pay attention to it, as opposed to I don't want to be in the supermarket and I walk by somebody and all of a sudden I'm getting a ding, and then I'm like, I have no idea what this context is, and it may be real, but it may not be real. But if I know that I get the ding and it's a good chance that it is real, then I'll know that to take that seriously. Okay, great, thank you, appreciate that.
Councilmember Groom.
Thank you, Chair. I appreciate it. And thank you, Jason. And I'm sorry, Mayor. Jason, I have 2 questions. They're kind of multi-part each. And you please feel free to get back to me. My concern, and I know I've mentioned it before, is the difference. What is the difference between the 2 peaks? So for instance, in April, our cases at our peak on a 7-day average was 10 cases per 100,000. But in that same day in April, the deaths were on the 7-day rolling average again was 34 cases per 100,000. But yet in this current peak, cases are going up extraordinary. So where before it was 10 cases per 100,000 on the 7-day rolling average, now we're at 56.4, which is a significant change and impact in the amount of cases. However, the deaths on a 7-day average is down to 11. What I'm looking for is, can you articulate the difference between the two? Right now, our case is at a crazy high, but yet it seems like the deaths are thankfully significantly very low. So we've kind of flipped. And that would be my first question. And I'm not sure if you guys need to get back to me on that, or what is your first thoughts on why are we not seeing the death rate like we were before?
So Councilmember Grimm, thank you for that question, and we definitely will follow up with you with more detailed information. Again, my hypothesis is when we saw cases during the first spike, we were significantly undercounting. And that then translated again into us focusing more on hospitalizations and then how hospitalizations contributed to death. The thing that we're seeing right now is a better capture. There still may be some slight underreporting of cases. Hospitalizations is always that key measure. And then we know that deaths are a lagging measure, but we also have a lot of improvements in our treatment of COVID when people are in the hospital. So when we were in the March, April timeframe, a lot of what we were doing was care that was being done honestly with us making just the best decisions that with information we had at that point in time with the remdesivir and other things coming out that we're seeing are helping to prevent those people that are hospitalized going to death is really important. I do think it's important though that I talked about this a little bit before, that our greatest concern isn't only deaths for people that are hospitalized or people that come down with COVID. We're hearing a lot again about those long haulers, those people that have the chronic health effects associated with COVID and that are not able to return to baseline health. And so there's both a mortality issue associated with it, but there's a quality of life issue associated with it. And when we talk about those individuals that cannot retain their same level of lung capacity, or those individuals that may have cognitive impairments, individuals that may see more significant damage to certain organs in the body. Those are the other impacts that I think it's important, as this virus is completely novel and new, that we're going to be learning about more and more. And hopefully we balance both the deaths with the quality of life impacts of this virus.
Do you have what is the percentage of cases that are classified as this percentage of quality of life? I can tell you, obviously I've experienced it, but other people that is in my world, again, that's my limited filter, in my world, symptoms are definitely not extreme. So I guess I would be looking for what is that factoring versus, and again, I'm not looking to turn us in a different direction. I mean, we got to get this controlled. I'm looking at, is there any different way we can look at the statistics to improve our situation? So that's why I'm asking. And then my other question is in regards to symptomatics. It seems like to me, we really don't have control over what the main symptoms of COVID is. We've came out really strong with this fever thing, but it's a 50-50 toss up if someone with COVID has a fever, but yet getting on a plane, they, will check your temperature, going into work space, they check your temperature. But with that being a 50-50 coin toss, I'm not quite sure if that's the right direction we should be telling people. Are we anywhere closer to narrowing down symptoms of COVID, uniqueness of symptoms with COVID. So we can change that word, change the fever part to, a lot of people are still going around going, well, I didn't feel well, but I didn't have a fever, so I didn't even get checked for COVID.
Yeah, it's a good point, Councilmember Groom, and that's something that continues to evolve as both the epidemiology and the literature evolves in this area. We know that temperatures were the major focus early on. We've gone away from that to listing all of the potential COVID symptoms that we feel are validated both through the medical community and the literature. Those are all posted on our website. It includes fatigue, diarrhea, body aches, shortness of breath, headaches. One we often hear is loss of taste and smell, sore throat. Unfortunately,
Well, the loss of taste and smell is pretty much a last of your symptoms. Like the symptoms change. I think we need to narrow in on what are the first indicator symptoms. Majority of people, again, in my filter, I know it's extremely small based on the data that you're looking at. Loss of taste and smell didn't come until the end. And then, so that was my point. And then I am significantly out of time, but I did want to leave you with one last question. It still seems like the top 3 or 4 counties in Colorado are making up greater than 75, if not 90% of the cases. What is Denver, Arapahoe, Jefferson, those types of counties doing? What are the indicators? I mean, they are like 100 times more than Broomfield cases. What are they doing in those specific counties in order to control it? Because they seem to be the leading of Colorado, and the rest of us are kind of paying for their sins.
Yeah, Councilmember Groom. Well, one thing is we're all in this together in the metro region, and I do get your point. But the second thing, I already alluded to the policy interventions that Denver and Adams County have pursued, such as curfews and limiting alcohol sales and other measures. So I'll be happy to make sure since we're out of time, follow up with you directly to get you that information.
I greatly appreciate it. Thank you for you and your team's work. I appreciate you guys. Bye-bye. Thank you, Mayor.
Councilmember Schaaf.
Thank you, Mayor. So I just got an update, Mr. Valling, at the school board meeting. BVSD superintendent recommended preschool through 12th grade switch to remote only next Tuesday. So it looks like BVSD will be joining the other metro school districts in going to remote only. So that is a disappointment. You know, we in Broomfield and we as BVSD and many of the counties have worked really hard to keep our numbers low so that our students could be in school. So it looks like the last of these school districts does fall, which is disappointing, but it is where we are, and we've got to reverse this trend. You know, there is a lot of misconception regarding the positive cases of the asymptomatic versus the symptomatic. Could you talk, as you've done that contact tracing, what is the breakdown for those positive cases for people that are experiencing symptoms versus people that aren't experiencing symptoms? Is it 50-50 or what's that split?
Yeah, actually, I'm going to let Dr. Urbina address that. So Chris, do you want to take that?
Sorry, Council, I was late. I was actually at that Boulder Valley School District meeting where they made that decision. So I'm sorry for being late. The answer to your question is we don't know. And the national data and international data, as well as some of the studies we've seen across the country, we estimate asymptomatic carriers to be about 30 to 40%. Now, what happens a lot in our contact tracing is that people don't recognize they have minor symptoms. They may have the sniffles, but they don't really count that as a symptom. They may feel kind of achy. And so the challenge is they call that asymptomatic, but it really isn't asymptomatic. So the answer to your question is a difficult one, but we estimate anywhere between 30 and 40% to be asymptomatic.
So I just want to clarify, Dr. Urbina, so you said that that they're not truly asymptomatic, though. Could you talk about some of those maybe more mild symptoms that are being experienced and maybe that maybe being overlooked?
Sure. Well, we try not to overlook anything, Councilperson Chef.
And I should have clarified, being overlooked by the individual themselves, not by the medical professional.
Sure. So I think you're right. Generally, we see upper respiratory infections, upper respiratory symptoms like sore throat, congestion, achy feeling, fatigue, headache. Those are really, and I heard the question by another council person earlier, is that those are the usual early signs, the mild upper respiratory symptoms, sometimes nausea, vomiting, achy feeling, sometimes diarrhea. All of those are the mild symptoms, but people just say, oh, it's just a common occurrence. I get these symptoms every year. So it isn't until we know for sure, and sometimes that loss of taste or smell can be the first symptom that people present and they have no other symptoms. So it isn't a late symptom. It can be at any time it depends on the individual. And that's the challenge with this infection, is it has so many effects on different organs that we can't tell you exactly. And that's why we encourage people to get tested when they have symptoms, they've come in contact with an individual, or they've been exposed in an area that has high prevalence of the infection.
Great, thank you. So the last piece that I would throw out there is, following up on Dr. Urbina, is with those mild symptoms. We've talked a little bit about the different testing sites that are available. Mr. Valling, could you recommend, or what testing facilities would you recommend for Broomfield's residents?
Yeah, so obviously we've been doing outreach to our partners, specifically our healthcare facilities, to see what testing they're providing and what those options are. That's something we would be happy to prepare for council. The one thing that we heard as we did that outreach is the reason our HHS site is so popular is when you're going through some of those other sites, some of the, you got to have that virtual visit first, and then you have to schedule a time. Then sometimes if you're doing the PCR test, you're waiting, it could be 2 to 4 days to get your results back. And we see our HHS testing, the antigen testing, just being a complement to that for those individuals that are positive. We do have all of the testing sites up on our website. I can share with you that I have been having conversations directly with CDPHE, Boulder County Public Health, and Tri-County Public Health of what can we do to bring a community testing site up to more of the Westminster, Broomfield, Boulder location. And that would be something that they would specifically take on. The challenge will be finding a location that's best suitable for that. And we're in very initial discussions, but given that we are one of the hot spots in the state along with Boulder and Adams, hopefully that can help us with some of that testing capacity as well.
Great, thank you so much. Appreciate it. That's all I have, Mayor.
Thank you. Mayor Pro Tem.
Thank you, Mayor. Mr. Valling or Dr. Urbina, how do we combat the dangerous and false information coming from the top that are trying to play it down, say, I got it, I was fine, or denying that it's as bad as it is, or that masks don't work? How do we combat the misinformation and the disinformation that is being spread by some leaders? I find it really irresponsible. And I just want to call that out because, just because you had a mild experience in no way makes this pandemic, this virus, less dangerous. And I would like you to comment on that, please.
Yeah, thank you, Councilmember Castriata. And as you know, public health, we go based on the science and the data. And I'm excited to see that there will be an embrace at the national level of those public health scientists to get our messaging out and hopefully a national strategy. The other thing that I think is very important to us is that we're very honest too with what we know. Is that we do know that people that have COVID, some will have mild symptoms and they'll recover, but others won't. And so we have to be very objective and direct in what our data and our research shows. And what we know is the most effective mitigation strategies that we have. So that's my response to that. And that's one thing that this public health department will continue to do is I really believe that this is a public health issue, not a one side of the political aisle or another side of the political aisle issue. And if we could all come together as a community and embrace it as a true public health issue, I think the sky's the limit on what we could actually achieve.
Councilmember Jason, can I add something to that? Councilmember
Sure.
Castaneda? So our public information officer working with the city and county of Broomfield have done an excellent job of getting information out there. And so we do very innovative social media campaigns. We do lots of pushing out information to our schools, pushing out information to our businesses, so that they have in hand, and our website is actually very good at not only sharing data, but sharing tools and expertise and education. And our staff spend a lot of time talking individually with daycare centers and schools and long-term care facilities, so they get the accurate information that they need. And we're also working with our healthcare systems, our providers, UC Health, and Good Sam and all the other Centura hospitals, so that we can get that information and work closely with them. Because it's just not us that's providing this information. It really is our whole network of folks. And as I like to say often, we want to spread the information, not the infection. So hopefully you can be partners with us and make a difference in making that change.
Thank you, Dr. Urbina. I believe we all have a responsibility to support our public health officials in a data and science-based approach to fighting this virus. Otherwise, we'll be back in the same situation if people don't take it seriously. So I appreciate your comments. That's all. Thank you.
Thank you.
Councilmember Anderson?
Thank you. I appreciate Councilmember or Mayor Pro Tem just clarified one of the things that one of the comments I want to make is that we really need to be careful about where we're getting our source of information from. So I do just have one question left here. Is I know we don't have that exact statistic yet, but I do want to hear just a little bit more about the individuals that don't fare so well and the long-term health impacts. I just heard about somebody who has a pulmonary embolism and stuff like that. I mean, what are we really looking at here for those individuals that develop something that's not so easily, that they don't waltz through so easily? Like, what does that really look like? Are we seeing?
So, Councilmember Anderson, I appreciate you bringing that up, and we've been bringing on such a strong team. They've actually done a comprehensive literature review of the information that's out there, and a couple key points that I want to highlight, and then we'll make sure that we get this out to not only our council members, but to the public, is only 39% of individuals who were hospitalized reported a return to baseline health within 2 to 3 weeks after COVID-19 testing. Among individuals not hospitalized, 35% reported not having returned to their baseline health within 2 to 3 weeks. And then we're also looking at some of those chronic symptoms that extend beyond 12 weeks and what those are. So that we have I can hold up a full report that we've put together, and unfortunately I didn't have the time to put it into a good communications document, but this is something we'd be happy to share with council and the public.
Yeah, I appreciate that very much, and thank you. That will be helpful information, I think, for all of us to understand. So thank you.
Okay. Councilmember Groom.
Yes, thank you, Mayor, for a second time, and I'll make it very quick. I wanted to address Mayor Pro Tem's comments. I feel that it's very responsible to address statistics and support the health and safety of our residents. This is not just my opinion. I do get calls and concerns associated with people seeing the other side. I don't know the percentage, but it has nothing to do with any council member or public representative not believing in COVID and the seriousness of it. Right now, we are in a serious situation with our cases increasing, and I feel like we absolutely need to challenge the way of thinking, so we understand how we can make public policy for the better. Masks and social distancing are not working right now. We need to do more. And what is that? So that's all I have to say, but I would be happy to have that dialogue with you, Councilmember Castrata.
So, Mayor Pro Tem, I'll recognize you. We have a long night. I mean, we could have a point counterpoint for the rest of the evening. Go ahead, Mayor Pro Tem.
I'm wondering how a council member has all of a sudden decided that masks and social distancing don't work.
Okay. Your point's appreciated. Councilmember Tessier.
I just wanted to add too that it's people wearing the masks that has to happen, and that the 3 W's are clearly the methods for reducing transmission, and that we got to get everybody wearing those masks. So I would say it's people not wearing masks that is probably not working over the latter. So just wanted to put that out there. And thank you to Dr. Urbina and Jason and Deb and please pass along our gratefulness and our gratitude to your team. I know you guys are working super, super hard, so we appreciate you.
Okay, Councilmember, I've already recognized you twice. I'm going to go ahead and go. We do have.
I know, Mayor. I just wanted to follow up and say.
No, we're not going to.
Our numbers are going up.
Point of order, Mayor.
Kim, we're done. Could you please? We're done. So we have public comments. And we do have one public comment, and it's Dr. Erickson, and and he signed on and he wants to talk about COVID-19. So I'm going to go ahead and recognize Rick. Rick, would you identify yourself in your neighborhood? And you have 3 minutes.
Hi, my name is Rick Erickson. I'm a retired physician. I'm from Ward 4. I've been listening to a lot of this COVID and how the hospital ICU beds are increasing. It doesn't look like it's that much. It was 77% in July and has increased to about 82% now. However, a big increase is going to happen if people don't get their flu shots. And I've listened to the town halls, and there's been no exhorting people within the community to obtain flu shots, and people should not neglect that, because influenza is a major contributor to ICU utilization, and that needs to be pushed very hard in the community. Number two, and looking at the data that's been presented, I went through to look at who was getting hit the hardest, and it goes along with the article that I wrote to the Broomfield Enterprise in May of this year. If you look at the population between 0 and 50, there were 830 reported cases and 0 deaths, which goes along with this disease does not affect as greatly the young people. The mortality rate is extremely, extremely low if you're below 40. And I'm watching a lot of people in this community who call up to your town hall and they're terrified. And this is not a disease that needs to be dismissed, but I don't think we need to have this much fear, which isn't healthy for the immune system. And it's also causing a lot of other dysfunction in the community. what we need to really push in this community is as the Swedish have done. And if you look at the Swedish data where they don't have any masks and they sit 1 meter apart from each other in the restaurants, along with having their schools open to up to age 16, they've got the same mortality rate as Broomfield does, by the way, right now. But they are pushing very hard for people 65 and 70 that they need to self-isolate. And this morning when I was picking up my groceries outside of King Soopers, I watched a bunch of older people coming out that looked like they could barely walk to the car who were picking up groceries. And those people really need to stay at home or have someone bring groceries to them, or they need to get them picked up. But they shouldn't be. We need to protect our elderly, and they need to realize that if you're over 75, your risk compared to someone under 17 is 3,000 times greater. And they need to be very cautious, especially our older people. They need to self-isolate as much as possible because they're the ones that are going to be hit. You look at the hospitalization. Look at we've had 43 confirmed deaths in Broomfield. And out of those, 31 were over 80 years old. It's the majority of people
I need you to wrap
who
up.
are elderly are the ones that are going to get affected.
Yeah.
So I think we need to have something on our website, and we should show what the relationship is between age and the death rate is, and we need to caution our elder citizens that they need to remain out of public places assiduously. Thank you very much for allowing me to comment.
Thank you, Rick. I'm going to go ahead and close out the Board of Health. There is no further business before the Board of Health. The meeting is adjourned. There is no business tonight before the Broomfield Housing Authority. Let's move to item 7C, which is Resolution 2020-226. So next is Council's consideration of proposed resolution number 2020-226. Which staff will explain. I didn't write down exactly. I mean, it's on the machine. I'm ad-libbing here. So council has a copy of the agenda memorandum, which staff will summarize.
Thank you, Mayor and Council. Briefly, Chief Krieger will walk us through this item, and also Deputy Chief Mike Clement is on the line as well to field any additional questions. Thank you.
Good evening, Mayor and Council. So the Tech 3 is a body scanner. It's a non-invasive scanner to detect anybody coming into the jail that may have ingested or concealed prohibited items prior to getting into the jail, things like drugs, weapons, contraband, cell phones. It replaces the need for strip searching, which obviously is quite invasive and as well as difficult for our staff to do. The body scanner is a safe tool. It's used in jails throughout the United States. The cost of this is $159,000. It's being paid in total out of inmate welfare funds, which are restricted funds under state law, and this is an allowable expense under those funds. And again, I have both Deputy Chief Mike Clement, who runs the jail, as well as Commander Hartman, who is the commander of the jail, and who worked on this project to answer any questions you might have.
Okay, so we'll now proceed with public comments. If there's anyone who would like to be heard, the number is 855-695-3744. Press *3. State your first and last name and neighborhood for the record. I'm not noting anybody for the specific item. So we'll go to council questions and comments next. Councilmember Law Evans.
Thank you, Mr. Mayor, and thank you, Chief. I'm the one who pulled this off the consent agenda, and in general, I think I favor this, but one of the questions that I've gotten on this topic is when out at Denver Airport, the new to me airport, right? When they put these scanners in, there was the whole, I guess, scandal about how they were, I don't know how else to say this without just like saying it, but they were revealing potentially of people's personal body details, things like that. So I guess that's what the question that I had was, how does this, if it replaces the need for a strip search, which is certainly invasive, how does it do that without, or does it do that without invading the inmate's privacy in other respects.
Well, Councilmember Law Evans, one is at an airport, obviously, where the public's going through, and the other one is entering into a jail facility. And clearly, a strip search is even more invasive. But I'll ask Commander Hartman if he could kind of explain what is viewed.
Thank you.
I think in your packet, you could probably see some of the pictures that basically shows the outline, and then it will show anything and highlight anything that's contraband. So it's not revealing, showing body parts or anything like that. Basically, it kind of looks like a gray dummy with what you see is the contraband that may or may not be on the individual.
Interesting. So, and it must just be the software programming that allows it to identify. I mean, well, you know what? I'll follow up offline with you folks. I think that this is a great idea, and I think if it reduces the invasion of privacy for the inmates, it's a terrific idea. And certainly, if it helps the workload on the staff, I think that's a terrific idea. I'm confused as to how it works, but I'll follow up offline. I appreciate this very much. Thank you, Mr. Mayor.
Okay, Councilmember Schaaf.
Thank you, Mayor. So back to the council detention tour with the staff. I was fortunate enough to go along with many of the detention staff and tour. And one of the things that I heard most often talked about was the body scanner and the need for this body scanner within the detention center. But if I'm not mistaken, right now, most of the liability with our detention center exists in our booking area, and that is where this body scanner would be housed and where it would be most critical. So how does this body scanner reduce that liability for our police department?
So, Councilmember Schaaf, it's a type of low-grade X-ray machine that detects foreign objects. And the biggest risk that we have is anytime somebody is first entering in the jail. And so we would use it. Everybody enters the jail through booking. And it's, again, people that are under arrest being housed in the jail. So it detects any of those items that pose a risk to either the staff or other inmates coming into the jail. So any ability we have to ensure that they haven't either secreted those items or ingested those items help to increase the safety in the jail and decrease liability just simply because we're not having to do that in more invasive kind of search that may subject us to higher levels of liability. And Commander Hartman, anything to add with that?
Well, yeah, obviously, if drugs are getting into the facility, you risk an inmate getting seriously ill or even dying from overdoses inside the jail. And this will give us the opportunity to avoid that, because now if we want to do a strip search, we have to have probable cause to believe that they have drugs or a weapon on or in them. So then we can proceed to do that. Where this one, we can run everybody through. And there's people that we have come in here who, are looking normal every day and have given us no suspicion that they're bringing in drugs or a weapon and could possibly bring that in because we're not going to be doing that type of search. But with this scanner, we're able to put everybody that comes into the facility through, and we're going to stop those particular items from getting inside the facility.
It was great to hear. I'm fully supportive of this, and I look forward to really assisting the police department and the detention center staff, in decreasing their liability, but being much more careful with how they're processing incoming inmates. Thanks.
Okay. Next is council's consideration of proposed resolution 2020-226. Will the clerk please read proposed resolution number 2020-226 by title?
Resolution number 2020-226, approving an agreement by and between the City and County of Broomfield and Tech 84 for a body scanner.
Councilmember Law Evans.
Thank you, Mr. Mayor. Excuse me, I move that resolution number 2020-226 be approved.
Councilmember Schaaf.
Second.
Is there any further discussion? Will the clerk please call the roll?
Castriata,
Yes.
Groom,
Yes.
Tinkle,
Yes.
Jezierski,
Yes.
Law Evans,
Yes.
Lim,
Yes.
Lindstedt,
Yes.
Schaaf,
Yes.
Tessier,
Yes.
and Anderson.
Yes.
Okay, it passes unanimously. We have a public hearing that's next, which is going to take a while. So let's go ahead and take our 10-minute break and come back at 8:05. We'll come back at 8:05.
The Access Live event is in music hold.
Okay, Doug, can you hear me?
Yes, sir. Yes, sir.
Let's go ahead.
All right. Kicking us off, music hold in 5, 4, 3, 2, 1.
Music hold ended.
Okay. Our next item under council business this evening is the public hearing and council's consideration of proposed resolution number 2020-247, approving a final plat and a site development plan on land within the North Park planned unit development, plan known as the East Village neighborhood. I'll declare the public hearing open. First, we'll follow our city standard public hearing procedures. First, staff will present a summary of the proposal. Next, we will have the applicant's presentation if applicable. Then we will ask for public comments and final comments from the applicant, and finally, questions and comments from the city council. Council has a copy of the agenda memorandum, which staff will summarize.
Thank you, Mayor and Council. Good evening. Anna Bertonzetti, Director of Planning, will introduce us to this topic, and then, of course, the applicants will have a very brief presentation and be available for council questions. Thank you. Anne?
Thank you, and good evening, Mayor and City Council. Could we have the next slide, please? The applicant this evening is requesting consideration of a final plat, a site development plan, and a subdivision improvement agreement for a property located east of Sheridan Parkway and south of State Highway 7. The plat encompasses approximately 263 acres. This is shown in the yellow outline, and the site development plan includes just over 84 acres, and that's shown in the red outline. Next slide, please. The comprehensive plan land use designation for this site is mixed use commercial, and the proposal this evening is consistent with that designation. Next slide, please. The final plat establishes lot lines for 232 residential lots, 12 super block larger lots that are intended for future development, and 66 tracts. The plat also dedicates right-of-way and easements to serve the proposed site development plan. The 66 tracts are utilized for on-site open area, landscaping, tree lawns, private alleyways, future public roadways to be dedicated with future platting of the adjacent super blocks. Next slide, please. The site development plan includes 232 residential lots. 102 of those are attached units and 130 are detached units. These are interspersed with private open areas and public and private streets. The development is proposed in 6 overall phases, generally moving from north to south. Setbacks and off-street parking are consistent with the planned unit development requirements for North Park, which you may also hear called the baseline community. And the setbacks and development standards are outlined in more detail in the staff memorandum. Next slide, please. The East Village Site Development Plan area is within an area of Brimfield that has existing plugged and abandoned wells. The plugged wells are between 450 and 1,350 feet from the site development plan boundaries. The existing extraction pads along Northwest Parkway are over 2,500 feet to the south of the site development plan boundary. The final plan includes all required notices, notes regarding the future notices for future property owners because of the existence of the plugged and abandoned oil and gas wells in close proximity to the final plat area. Since there are also areas of the final plat that are within 1,320 feet that are not planned for residential but could be planned for residential in the future, subject to a future site development plan proposal that would require city council review, there is also a note regarding the proximity of the edges of the final plat to the existing wells along the Northwest Parkway. And those are all consistent with the Brimfield Municipal Code requirements. Next slide, please. The on-site landscaping accounts for over 25% of the site area. Landscape treatments are concentrated along streets, within pocket parks, and along internal green landscaping. Pocket parks include a variety of amenities for residents, such as seating and picnic areas, shade structures, play structures, and play lawns. Park Lane is a private street that is designated as one-way. It's a shared street where pedestrians and vehicles share the road. This is in the upper right of the screen. The applicant will provide additional details regarding the parks and Park Lane as part of their presentation. The internal trail and sidewalk network will tie together these amenities while also connecting to the adjacent neighborhoods and future parks and trail corridors in the area. Next slide, please. The plans do not include builder-specific architecture because this detail is not known at this time. The site development plan includes illustrations that convey a general character, and all architecture will be required to meet the requirements of the PUD plan and will also require review through the North Park Design Review Committee, which is above and beyond the minimum Broomfield standards. The applicant is requesting consideration that all builder-specific architecture be reviewed through the city's site development plan administrative modification process with a call-up provision by City Council. The current process, which is utilized for the West Village area, requires individual home builders to complete a full site development plan amendment process, including 2 public hearings, one with Planning and Zoning and one with City Council. The proposal from the applicant this evening would utilize the administrative modification process to be completed at a staff level with final approval from the city manager's office, with a call-up provision that would allow any single council member to be able to call up the decision for additional review through a public hearing with City Council. Next slide, please. The concept review for this project was held in January of 2019. Details regarding how items were addressed from the concept review are provided on the screen, as well as were detailed in the staff memorandum. Next slide, please. The subdivision improvement agreement is proposed to outline the obligations for completing public and private improvements associated with the project, the timing for public land dedications, and the obligations for affordable housing and off-site infrastructure work. Affordable housing is addressed through an affordable housing covenant that's referred to as a facilitating covenant or a deed restriction that is on Lot 1, Block 9 of the plat, which I believe has been recorded by the applicant. The parcel is located at the southern edge of the site development plan area, and this would be the first of many phases of affordable housing as North Park develops in the future. The parcel will be developed with no less than 35 dwelling units per acre, all affordable. And if the total affordable or attainable, and if the total number of units is less than 12.6% of the total number of residential units within the SDP, then the owner has obligations to provide additional land, cash in lieu, or additional units to ensure that that minimum is met. The Housing Advisory Committee has reviewed the developer's proposal and believes that it's appropriate and has accepted that proposal. Next slide, please. This just shows the location of the affordable housing in relationship to the East Village residential. It's directly on a trail corridor and Sheridan Parkway. Next slide, please. The public land dedication as part of the subdivision improvement agreement obligations, the owner will be dedicating 6 parcels along the Northwest Parkway as identified as required within the planned unit development plan for baseline. This is approximately 27 acres. These will be dedicated as open space, and it will be done by the end of 2021 per the subdivision improvement agreement. And this is in addition to the open areas as previously identified that would be constructed as part of the site development plan. Next slide, please. The City and County of Broomfield standard public notice requirements have been met. This is in addition to the applicant completing notices for the homeowners associations in the area. Staff has not identified any key issues with this proposal. The Planning and Zoning Commission reviewed the proposal in September of this year on the 28th. They recommended approval with one condition. The Planning and Zoning Commission desired that future architectural plans submitted by individual builders go through the full public hearing process for a site development plan amendment. The applicant's response was to add the provision for a call-up by any single council member as previously summarized in my presentation. The applicant's team is present this evening and has a presentation as well, and this concludes staff's presentation.
Okay, we will go with the applicant's presentation. Just so we encourage staff to keep their presentation brief, please keep yours concise as well. Will the applicant's representative please identify themselves for the record prior to beginning their brief presentation this evening?
Good evening, Mr. Mayor and members of council. This is Kyle Harris. I'm the general manager of McWhinney's Baseline Project. Also with me this evening is Alicia Hammett with Norris Design, who's also going to co-present. And we have a few other folks who are able to answer questions afterwards. Next slide, please. As indicated, the East Village community is sort of sandwiched between Sheridan Road to the west, the Parklands to the east, and Center Street District to the north. Next slide. This slide shows what we anticipate to be a full build-out projection for East Village, which represents approximately 1,100 units. We're showing this to indicate what we anticipate to be the phasing of the project. At this point, we're looking at 4 phases. The first one being the perimeter within or bounded by the red perimeter. Second one being the teal area. Third being purple, and the fourth being the yellow. Next slide, please. We have some requirements within our SIA that are a little unique, and those will be the next few slides. We have agreed to produce or develop the first phase of our Parklands portion of the Parklands, which is the big green, which is what you see here. It's just north of 5 acres in size, and we have agreed to triggers for when this would happen, which you can see here are at the issuance of 375 building permits. That's when design begins and an SDP specific to this project is submitted, and then construction begins within 9 months of 580 building permits being issued. Next slide, please. As indicated earlier, we will be conveying land to the Broomfield Open Lands, and these are the parcels that you see below 160th Avenue, and 27.59 acres is the acreage that will be conveyed. Next slide, please. Additionally, as was discussed about affordable housing, we are locating that adjacent to Sheridan Road, as well as a portion of the Parklands, as you can see here contextually, which is also adjacent to one of the regional trails that's proposed for Baseline. Next slide, please. This gives you a better sense of where the affordable housing parcel is located relative to the other areas of East Village. Next slide, please. And this, I want to be clear that the SDP and proposal that we have this evening is not to approve this, but we wanted to give a sense of the site planning that has already been undertaken for the affordable housing site. And as I think I mentioned before to council, we're looking at 184 for rent units as well as 24 sale units as configured here. And it's this site plan that has sort of governed the encumbrance that Ms. Burton-Setti referenced earlier. Next slide, please. And so just a little more detail on the affordable housing covenant. It covers approximately 4.5 acres. It's a parcel we just saw. We anticipate density of 45 DUs per acre based upon that site plan. The site is restricted for rent at 60% AMI and or for sale at average 80% AMI in conformance with the Broomfield ordinance. And then upon recordation, Baseline receives 204 affordable housing credits. And that at the end of the 8-year period, as Ms. Burton-Setti said, if we are unable to achieve the required amount of affordable housing units on that parcel, we have to either do cash in lieu, land in lieu, or provided a different location for affordable housing. Next slide, please. At this point, I'm going to turn it over to Ms. Hammett to take us through the next few slides.
Good evening. I'm Alicia Hammond. I'm a planner with Norris Design. This shows the first phase and the limits of the East Village SDP that you all are reviewing tonight. If we go to the next slide, please. Connectivity, community, and stewardship are the pillars of the urban design for East Village. This community is designed around a system of gardenways and central shared streets, or a central shared street, or Woodruff known as Park Lane. It's going to be one of the first pollinator districts in the state, which we're really excited about. And here are all the sustainability goals that this community has incorporated. So promoting pollinator habitat, a commitment to EV conduit in the garages, in all the garages. It's walkable, there's publicly accessible bicycle parking, and the builders will be required to have a HERS rating of less than 50. If we go to the next slide, please. These are the garden ways that connect people and pollinators throughout East Village, and you can see where they connect. The pink line is Park Lane, which is the shared street, and they all lead to the Parklands, which is the long linear park to the east of East Village. Go to the next slide, please. We have entry planters at the beginning of the garden ways. These are all filled with pollinator habitats and really serve as kind of the front yards for the community. If you go to the next slide, please. Another view of the garden ways here. If you go to the next slide, please. Little Green is one of the community neighborhood parks that's north of Park Lane. It has a half moon plaza that's perfect for small gatherings and farmers markets. It's got festoon lighting, custom shade structures, picnic tables, hammocks, and pollinator gardens, and an open lawn for volleyball and lounging, and a playground. We could go to the next slide, please. This is a view from Park Lane. We have these little illuminated pavers that provide this nice warm glow for residents, so that it can be an active place day and night. If we go to the next slide, please. The Yard is a passive park located at the northwest terminus of Park Lane. The park is mostly an uninterrupted green area, perfect for soccer, lounging, and picnics. The park also offers pollinator gardens and hammocks, so this is a more passive space. Go to the next slide, please. Park Lane will live like a linear park or plaza. The Woonroof is designed with a 13-foot pedestrian amenity area with seating and planters. A 10-foot one direction travel lane is provided along with an 8-foot parking lane. The entire street is designed with enhanced paving. Illuminated pavers will offer a soft glow at night. You can guys see that up close here, along with hanging street lights. Go to the next slide, please. So here's another view of Park Lane looking east. If you go to the next slide, please. Reiterating staff's presentation, East Village has included representative architectural character as part of the SDP. If you could go to the next slide, please. The future community will offer high quality, small lot, single family homes along with townhomes. The architectural character shown here meets the North Park PUD requirements and has been approved by the North Park Design Review Committee. Thank you. And the design team is here to answer any questions you may have.
Thank you, Alicia. We have a few more slides. If we can go to the next one, please. Just a few comments on DRC. Our DRC is responsible for reviewing the plans for all development, including construction of any type, landscaping, lighting, signage. You can barely turn a shovel of dirt at baseline without it going through the design review. And the important point here is that it is not a one and done process. You don't simply submit one time and then you're finished, but rather it's an iterative process, which really helps to ensure the applicants don't get too far down the road before a check-in to make sure that we're in lockstep with the direction in which they're headed. So we have DRC preliminary sketch review, which is prior to these plans going to the concept review. We have schematic design and design development review, which is required before we allow applicants to go to the SDP process with Broomfield. And we have construction document review, which we require through our DRC before going to the city for a building permit. And then even once things have been built out, the applicant has to go back to the DRC to get a final certificate of compliance before they can go to Broomfield for certificate of occupancy. Next slide, please. And so the criteria by which our DRC reviews applicants is shown, or a partial view of what they review it against is shown here. And I would summarize this by saying, we want the projects to be aesthetically pleasing. We want the elevations to have a variety of materials, textures. We want to have appropriate massing, the mix of colors. We want high quality in the design. Next slide, please. And next slide, please. There we go, great. So it was mentioned that we were still hopeful of being able to have administrative review for the architectural SDPs, which in East Village is actually a fairly small amount. It's really just the 3 for sale builders that we have. The apartment project, other larger projects will still go through the normal process. And then the compromise, as was mentioned earlier, was to have a call-up provision by any member of council. And you may ask, well, why are you guys asking for this? And it's really because of timing. An administrative SDP, 3 to 4 weeks versus the full bore process, the alternative, what's currently the process, which takes us about 3 to 4 months. And when you're trying to coordinate builder closings, and by the way, the builders will not close until any discretionary approval, they won't close if those discretionary approvals have not happened. So in any event, it will help us out immeasurably with these closings, with the builders. We're trying to coordinate closings. And then at the end of the day, there is, hopefully council recognizes there is a very rigorous review process through our DRC. Next slide, please. And here's who's on the DRC. We'd heard comments before about, oh my goodness, it's just a rubber stamp by McWhinney. Nothing could be further from the truth. These are the members of our DRC: Jim Tolstrup, High Plains Environmental Center; Amy Yarger with the Butterfly Pavilion; Dave Williams, Director of DTJ; your very own Anna Bernzetti; and then Kim Perry is the one person, the one McWhinney employee who's on the team here. So these are a group of professionals that are rigorously review all of our projects. I will make just one last thing. This is our last slide, and that's to say that if council's not quite ready to do this and have this administrative review with a call-up provision, we would, if that's the thing that could potentially tank us tonight, we would rather cleave that off if it's problematic. If we can get it, great, but if it's something that's you're not ready for it, we understand and we could move forward without it. But we'd love to have it if you're willing. That's the applicant's presentation.
So we'll now proceed with public comments. If there's anyone who would like to be heard, please press *3. State your first and last name and neighborhood for the record. I'm not noting anybody that's called in on this item, so we'll go to questions from city council members are next. Please raise your hand and you'll be called upon. Councilmember Anderson.
Thanks. Sorry, I wasn't quite prepared. Okay, so I'll just address Mr. Harris's first question about that call-up provision. And my only concern with that is that we're also very busy, and I think we're attempting to make this change. And I just kind of want to make sure that we're giving an affirmative that council did recognize that we had that opportunity. So I more through our own staff maybe, but I would like to know like other people's feedback on that. Just to make sure that we're not missing this and that we're not overlooking this opportunity where we should be calling it up if we did have a concern. But I'm actually more in the area of being okay with it. I do want to, so regarding this development, maybe this is premature here. The Thunder Vista capacity, that remains, that the school capacity remains a concern, and what the plan is, the near-term plan is for the students of these new homes until that future magnet school is ready. I know I brought this up before, but if you could just give a quick update on where you're at in the communications with the school, that would be super helpful. That would be for Mr. Harris, I guess.
Yeah, sorry. Just trying to find the unmute button.
Sorry.
Yeah, no worries, no worries. So we actually have been very much involved with Adams 12 quite recently, as well as a number of Broomfield staff. Especially as it relates to the urban renewal area. We're in the process right now of proposing a bifurcated URA, and as part of that proposal, we're recommending Baseline is willing to allocate additional mill levy that would otherwise have come to us through our urban renewal area and have that go to Adams 12, because the big, hairy thing that has to be figured out with that school is financing. It's the funding of the school. And so obviously, and maybe others from Broomfield might be able to chime in on where we are with this, but I would say we have made good progress. We had a meeting with 2 of the Adams 12 board members. That was yesterday, I think. I lose track of time in COVID. And it was very positive. So we are working through our urban renewal area to provide additional funding to make the school a reality. To set expectations though, I think we all believe that in order for that school to happen, it still will have to go to a vote of residents to issue a bond. But if through other means, there's a way to achieve approximately 50% of the cost of the school, that is, you should probably hear it from Chris Godowski, but it sounds like that would be a more palatable thing to be able to go to the voters with if you're almost getting a school for half price. I hope that answers your question, Councilmember Anderson.
That does help. And then I guess the other part of that question was the first homes to be built, they would be bused to another. There's school capacity somewhere that those students, I don't know the timing of the future magnet school and when these first homes are built, but that is in the discussions, right, of where these students would be bused to.
Mm-hmm.
Correct.
I can't speak to where they would be bused to. I think the idea is now that they would be at Legacy High School, Thunder Vista Middle School, and I apologize, I don't recall the middle school. That's where I believe the students are going to be, are anticipated to go for the homes that are being developed at Baseline right now.
Okay, and then ultimately to that magnet school. Okay, thank you.
Potentially, but even the magnet school would be partially choice in, so it would be available for folks in other parts of the community as well as in Baseline.
Okay, thank you. And then, okay, then also on the, I just want to make sure that we understand when we're saying the EV conduit in all the garages, like what exactly does that mean? It's like, is that like 240 volt, 50 amp circuits? Does that have a plug-in where you just plug it? Plug-in's already built in, so you just pop it on the wall and plug it right in. Like
correct.
Okay, I just want to make sure that it was clarified. We have an EV charger, and it wasn't exactly an easy process without having that pre-wired. Okay, that is good. And the garden ways, those are excellent. I love the look and feel of that. But then the park lane, I have 2 questions on this, and these are my last 2 questions. The stamped brick road, that looks similar to the stamped brick that we had on Sheridan and 136 a while back before it was removed, and it was noisy and slippery. Do you foresee those being an issue and this material is being chosen, just we're not, in the same place we were, where the noise was, and this isn't the same speed limit, but do you foresee those, especially the slipperiness, being an issue on that stamped brick?
Appreciate the question, and the speed limit will be maximum 15 miles per hour, if not less. But I think what I'm going to do is, I saw Jared pop up there, so I'm going to look to Alicia or Jared to potentially address the questions about the material and choices there.
Thanks, Kyle. Good evening, council members. My name's Jared Carlin with Norris Design, and we've been working on the landscape architecture for the East Village. The pavers are going to be individual pavers, concrete pavers that'll have a great texture and feel. They won't be slippery at all, I don't think, and we can make sure that there's a slip kind of factor there as we look at finalizing those. And then we can look at selecting a paver that won't have as much of create as much noise either, even going at that slow speed. So we'll keep that in mind as we hammer out those details through the construction drawing process.
Okay, thank you. And then on this private road, my final question is the enforceability. I know this is coming up in a discussion we're having on a ring road in Anthem Highlands right now, and the police are unable, there's an enforceability issue. Is that the same? And this might be a Broomfield question more for our staff, is that an enforceable road by the Broomfield Police Department? I think is my question, as we're making sure that we understand what we're getting into here with that Park Lane Road. I'm not sure who can best answer that.
Yeah, I apologize. I'm not sure I'm in the best position to answer that. So perhaps somebody from Broomfield can help us out.
Councilmember Anderson, I would believe that this would be similar to the situation in Anthem where it's a private road. I'm not sure if, yep, there is Gary Krieger. He'd be able to answer specifically for the police department.
Yes, thank you for the question. So on private roads, there are certain laws that we can't enforce: DUI, reckless driving, hit and run, careless driving. But speed limit and some of those others, at least under current Colorado law, those are not enforceable on private roads.
Okay, and then do we foresee that being an issue that we should be putting some, I guess that's a question for Mr. Krieger, like, do you foresee it as an issue, or do we think we are okay with that being a private road from your standpoint?
Well, that's a little hard for me to say since it's the first time I've seen this, but it usually just comes up when people are disregarding the speed limits and the frustration that comes from citizens when we aren't able to enforce the speed limit. Generally, I think Mr. Harris indicated that the road is going to be a fairly low speed roadway and really isn't conducive to high speeds. So hopefully that won't be a problem.
Okay, thank you. And my time is up. Thank you so much.
Councilmember Groom.
Thank you, Mayor. I do have a handful of questions, so I'll go through them fairly quickly. One, I do have to say the open lands there by the fire department, I believe that's the fire department, and then down the road next to 470. I'm not quite sure how they are going to be public lands. There's really not an ability to access them. So I would like to see what Broomfield plans to do with them in the future. Can we plant more grasses so it's just not a weed induced environment like they pretty much are right now, just to make them a little prettier and nicer for the neighborhood. And before I go to my next question, anybody have any comments about that? That's just a concern, but I'll give you an opportunity to reply.
So,
okay.
Jennifer has, are there any plans for the open space?
Mayor Quinn, Kevin Stambridge here. What we would do is we would with other open spaces in the portfolio, we would program those sites for a management plan and would work with OSTAC and prepare that. The management plan would suggest any improvements, any trails. Obviously, there's oil and gas in the area, so we don't, we want to be aware of that in any planning that goes on. So we would expect the first step once those lands are acquired is to do a management plan for the open space.
Perfect. Thank you very much. I appreciate that. And then another question, a follow-up question to Councilmember Anderson. I am too worried about that Main Street there. I'll jump into my questions because she covered a lot of them, which would be the maintenance of the lights. Since that's a private road, that would not be Broomfield's responsibility, which would be the lights that are in the road. Is that a correct statement?
That is correct.
Okay, and then also in regards to the maintenance of snow removal, I'm assuming that would be you guys. Have you had any issues with blades hitting those lights and cracking them? I mean, I just don't see how they are good for our Colorado weather, our winter environment. What would be your concerns in that regards?
So the product that was specified is actually used in Denmark and all over Scandinavia. So much colder temperatures, more snowfall than here. So we anticipate it being a very durable product, and if applied correctly, shouldn't be a maintenance hassle for the Metro District.
Wow, thank you. Okay, well, technology is a great thing. And then one of my questions I already answered. I had concerns about the great pictures, but if those pictures had architectural requirements and metrics, and I believe Mr. Harris already has addressed that. So thank you. Very quickly on the DRC, great idea. I really appreciate you guys having that rigor before it even comes to Broomfield for that metro area. And then in regards to the call-up provision, a question for Broomfield, how would a council member know of the changes to even call it up? Like, where would we look and see those kind of things?
Thank you, Councilmember, for the opportunity to talk a little bit about that. This would be unique. So we believe that, as Mr. Harris mentioned, there'd probably only be 3 or 4 builders bringing through separate site development plans at separate times. So these would be a communication from staff with a copy of the memorandum outlining the details of the architecture and providing council with an opportunity to review. There is a 10-day window with the review as outlined in the proposal. So I would expect that in addition to an initial notice that we have an application that's in and has been reviewed and approved by the city manager, we would provide additional reminders during that 10-day window to make sure that there's ample opportunity to provide a call up, not just in a Friday email, but in a separate communication directly to council.
Yeah, I think that would also be great just to add it on a Tuesday council meeting agenda. Maybe in the manager's report or some other, just to make sure it's on the agenda also and not just an email. So thank you for that clarity. And then also, I just want to keep in the forefront of the development in regards to the school. I too am concerned about where the kids will be going to school, but also we are once again putting a school kind of right smack in the middle of the residential, and I just want to make sure that we're keeping an open mind and being very inventive, like we have for the Main Street with lights in the road, and that we have a unique plan for the school drop off. We have historically put schools in the middle of residential areas with the intent of kids actually walking to school. But that really doesn't necessarily happen in today's world for a number of reasons. So I do want to start bringing that up as a concern before we design ourselves into a regular hole of school drop-off. So no comments needed there. That was just a concern of mine. And thank you for bringing for sale units, affordable units, attainable units to Broomfield. I think you guys are doing an amazing job in working with affordable and attainable housing. Thank you. That's all I had, Mayor. I appreciate it.
Councilmember Schaaf.
Thank you, Mayor. I'll start at the call-up provision in here. I appreciate staff talking more about that. I am concerned about the call-up provision with this application at this time. Council's currently in conversations about our development process, and I would really like to have that process play out with council and the conversations with council before we start to allow individual developers to propose outside of that. And so I'm a little uncomfortable with that piece of this project. And I would say that I would like to see, this project really kind of come to fruition. We're just getting into kind of the meat of baseline at this point. We've kind of started out the fringe area, and now we're really kind of getting into the heart of baseline. And I would like to really kind of see how that's going to progress before I start to, let out some of that rope in this development. So I would like to just be able to walk along as this development gets produced. One piece that has, along with this development, a piece that I've been concerned about is the bike and pedestrian infrastructure there along Sheridan Boulevard. Could you further explain the pass and the bike infrastructure that is going along with this development?
Yes, so the bike lane along East Sheridan is a separate bike lane, so it's not a shared, it's a separate bike path that will lead to a trail that will lead to the underpass. So it's all connected and safe. So I don't know if that gives you enough detail about that along Sheridan, but it's an individual bike lane.
Yeah, not really. So this development looks like it's going to be, and I'm looking at page 16 of the council memo. There's a great map there, which talks about the proposed multi-use trail as well as the let's see, where is it? The dedicated bike lanes. So I'm imagining, and from looking at this map, so correct me if I'm wrong, but we are approving the infrastructure there along Sheridan, along with this development. Is that not the case?
That's correct.
Okay. So what we have right now is we have an on-street bike lane on Sheridan Boulevard.
That's correct.
Okay, and then the only other bike infrastructure that we have is going to be that multi-use trail with dedicated bike lane. And it looks like on page 16 that bike lane goes clear, away from Sheridan Boulevard and goes kind of through the middle of the baseline development. And while that's not a part of this this project, that is a piece that I'm just kind of confirming.
That's correct.
Okay.
But we also, this is designed as an urban development, and so there are, shared bike conditions and slow local streets. So we do believe that it will be a safe and bicycle-friendly neighborhood.
Okay. Yeah, I mean, I guess I can see that within the neighborhood itself, but I brought up my concerns about that on-street bike lane on Sheridan. My desire was to get a separated bike lane there going parallel with Sheridan. It looks like that bike lane is going to end up not going through the middle or not going along Sheridan, or kind of that separated bike lane, but more that dedicated bike lane going through the middle of baseline instead. Am I reading that correctly, Kyle?
Kyle, I'm going to let Kevin jump in here just real quick, and then perhaps you can fill in.
Well, I think Kyle and maybe Councilmember Schaaf, Kevin Sandwich here, along Sheridan, in addition to the buffered on-street bike lane, there's also a fairly wide walk/bike path along Sheridan. And what is the dimension of that shared use pathway?
That is 12 feet.
So 12 feet, that's intended for bicyclists and pedestrians. And that's, so Councilmember Schaaf, you have the on-street bike lane, then you have the off-street 12-foot sidewalk/bike trail. Thanks.
No, I appreciate that, because it wasn't clear when I was looking through the maps on that. So that does give a lot of clarification on what's going on there along Sheridan. I do think that that's a great improvement over what our current practice is with on-street bike lanes, especially south of 144th. There is no buffer, and traffic is whipping along at about the same speed. So I'm glad to see that added buffer is there, the infrastructure is there, and that's not to discount the proposed multi-use trail with dedicated bike lanes that's going through baseline. I think that's a great addition, and I look forward to seeing that coming to fruition as well, because I do think that is a great amenity for this development. So I didn't want to discount that at all. The other piece that I wanted to touch on was, well, actually two more pieces. One of them was the baseline specific micro and mass transit. I believe that there were going to be some baseline specific micro and mass transit options that were going to serve this area. Are any of those going to be serving along Sheridan Boulevard or crossing Sheridan Boulevard?
So we're assuming that the micro transit or things like, scooters or, other forms of transit would follow along the trail system that's within East Village. And then as far as mass transit options, I think it's that wherever the city serves is where, residents can walk to and catch the bus. So
I
think right now, without knowing what the specific micro transit options are or will be, it's hard to necessarily design for them, but we do have space built in to our streetscapes where it could accommodate, micro transit stations in the future.
Okay, for some like shuttles, and that's basically what I was trying to get at is that there was room that would be dedicated or to accommodate some of those shuttles. And I see Kyle's nodding his head. So that's great to hear, because that was my big concern, is that we were going to end up without space for those dedicated stops or pickups, things like that. Because that is another great feature of this development, is that kind of more micro transit, more small mass transit options.
Councilmember Sheff, if I could, I think you had asked a question too, whether that was going to be going on the other side of Sheridan.
Right.
The original plan that we had was for that micro shuttle to be interior to the community on the east side of Sheridan, so it would not be going to the west area.
Okay.
So there were 2 loops that we had planned interior, but not to the west of Sheridan.
Right, but I mean, the big one right there is, and I'm not quite sure the perpendicular street to Sheridan, but there is a pedestrian underpass there along Sheridan. So hopefully one of those pickups is going to be around there. So at least those folks that are on the west side of Sheridan will be able to cross safely to the east side of Sheridan and be able to pick up that small mass transit option.
Thanks, Devin.
Great, good to hear. All right, that's all I have for Mayor.
Okay, Councilmember Lim.
I wanted to pick up on something with walkability and connectivity there that Devin was keying on too. So I see the eventual connectivity here, but given the phasing of the project and the unknown timing here, it seems to me like that connectivity to State Highway 7 and that is somewhere off in the distance. And to talk about this as it's connected to State Highway 7 is not in the current plans. Can the developer address the timing? Otherwise, it looks like this little chunk that you're using as phase 1 is going to be very isolated and not able to connect to what it should be connecting to on State Highway 7.
Yeah, thank you, Councilmember Lim. Actually, the project that we're working on right now with the expansion of Sheridan Road does have sidewalks on both sides, so that when the East Village neighborhood is put in place, there will be connectivity to that sidewalk, which leads right up to Highway 7, and it's sidewalks on both sides of the street. In addition to that, where there is the grade separated underpass that Councilmember Schaaf was just referencing, part of the first phase of East Village is to actually have a ramp, ADA accessible ramp, which leads from Sheridan and wends its way down so that you can then access underneath that grade separated crossing to the other components of West Village.
Okay, I guess that will have to do for now, but I'm sure eventually it will be helpful for our people to actually cut through, on the diagonal through the development when that's there. Yeah. Okay. Then my other question is about oil and gas facilities. So it's the staff. This is directed to the staff, I think, first. So we have the distances to the oil and gas facilities map with a legend, which is very helpful. Thank you. The legend on the map, there is marked an approved permit to drill in green, 884 feet to the southwest of this development. Can the staff address that approved permit to drill? I have no idea what that is.
Thank you, Councilmember Lim. I may have to pull additional information from the COGCC's website to see exactly which well that is. We pull our information from COGCC's website directly, and some of these may have been permitted, but the timeline for that permit. I just would like to pull that information from COGCC to be able to provide that to you, if that would be acceptable.
Yes, but I mean, if someone can actually drill there, I mean, I'm not going to approve this development within 800 feet. I'm just not. So we're missing information here. And there's also wells that are marked on here that are abandoned locations, dry and abandoned, that aren't clearly marked that they're plugged and abandoned. There are other wells that are marked plugged and abandoned, but it's not clear exactly what state all of these wells that are surrounding this development are in. That's not clear at all to me.
And there should be there's no additional wells to be drilled other than the extraction wells that obviously are in various stages of process along the Northwest Parkway, but there are no new wells that should be drilled in this area. So I can pull that information. I'm not sure if Tammy Yellowco is also, looks like she's available and she may be able to address them as well.
Tammy was just promoted in, Anna. Tammy, can you speak to that briefly and then we can do a follow-up if needed?
Sure. So the one that is marked approved permit to drill, in fact, there is an approved permit by COGCC, but obviously no drilling has occurred yet. That's probably an older permit, and we would have to look into a little more deeply with COGCC to see if it could be, would still be in place given the other activity in the area. And then as for the plugged and abandoned wells, did you have a question on those, Councilmember Lim?
Well, some of them are marked in green, darker green, plugged and abandoned. Some of them are marked just pink, abandoned location. Some of them, and then there's one that's the closest that's marked dry and abandoned in different.
So the abandoned location means the operator planned to drill, but they've never done that.
Okay, but there's an outstanding permit. Is that also an outstanding ability to drill there?
Yes. And then the dry and abandoned means that the well was drilled and nothing was found and the location was then abandoned in accordance with the law. And then for the two, I just wanted to mention for the two plugged and abandoned wells that are shown, one at 758 and one at 884. In fact, the one at 758, it was plugged and abandoned in May of 2019, and we don't have any records that showed any contamination at that site. And then the other one to the southeast of the project at 884 feet was plugged and abandoned by extraction. There was some soil contamination, but that was remediated in accordance with the law and signed off on by the Colorado Oil and Gas Conservation Commission.
I would like to propose that minimally, given this location, that we expand the notification distance on the disclosures. So right now we're following our municipal code, which is outdated, I think, and limited in that it only requires notification within 200 feet. And it's in the final plat. In the general notes on the first page on 0.8 and 0.9, what the disclosure distance is, according to the municipal code. So I would like to ask the developer if the developer is at least willing to expand the disclosure notification radius to fit what we have adopted as an area of concern for oil and gas development within a distance of residences, and that would be 2,000 feet. So I would like to suggest that the developer consider expanding the notification radius there for the plug and abandoned wells, and next and in the distance to the existing producing wells to the south to 2,000 feet. So does the developer want to expand to that, or does Anna?
So just for some context, the approved permit to drill is 2,597 feet away from our development.
And thank you. And Councilmember Lim, if I could add just a little more context, I think there's a bit of confusion with what is shown from the COGCC website, and I'm not entirely sure why, but we entered into a right-of-way and development agreement with Extraction, which provided for the plugging and abandoning of any wells, of all wells that are located within baseline. And there is a time frame associated with that. And so some of the ones that you see that have already been plugged and abandoned are per that schedule. There may be a few others that have not yet been plugged and abandoned, but are on a schedule to have that be accomplished. And we were very careful to ensure with Extraction and others who might have drilling rights that those were in large part, I can't say definitively entirely, because there may be a few small mineral ownership interests, but the vast majority were with Extraction. And we have removed their ability to drill wells on our property. So I think it's hard for me to speak to a well that may or may not be within 800 feet. And I apologize, I just don't have that in front of me. But we were very careful to ensure that our surface was going to be free from oil and gas drilling.
And Councilmember, I would add that our agreement only does not allow Extraction to drill any other wells than those that are authorized by the agreement.
Okay, I'll accept that we're not going to have further drilling up there, even though the legend seems to be misleading there. My request is still that the plug and abandoned wells, my premise is that the plug and abandoned wells can still end up being a problem. We know that. Davis 43-6 is a problem in Anthem Highlands. We know that. So I'm asking the developer if he is willing to expand the radius of notification to 2,000 feet.
And I would respectfully ask if we are going to be asked to expand the notification for the plugged and abandoned wells. Is that something that would then extend to all plugged and abandoned wells within Broomfield? Because it does seem a little bit odd if we were being singled out for such notification, others weren't similarly tasked with such notification.
I can only speak for myself. If you're asking me, I'm going to bring this point. I will bring this point forward in any development that comes forward. But, that's just me speaking for myself.
So I would answer affirmatively if that becomes a policy throughout Broomfield and does not unfairly disadvantage us, then yes, we'd be willing to follow that.
Okay, thank you, Gene. Councilmember Lindstedt?
Yeah, just real quick. Thank you, Mayor. I was only going to speak to the call up. We're here at 9 o'clock at night and we have 5 more agenda items and reports left. And we have an extra meeting on 2 more meetings this year, and we've added an extra meeting each month. So I think this is a good opportunity to experiment and try this call up. We need to try it at some point because something's got to give. And I think a McWhinney proposal is the perfect time to at least experiment and attempt it. So that's all I got, Mayor. Thank you.
Mayor Pro Tem Castriotto.
Thank you, Mayor. And yeah, I think it's an interesting idea that Councilmember Lindstedt brought up about, giving it a trial run, but I do have questions because it's a new procedure and we haven't allowed this before. So I just want to make sure I understand how it's going to work, because what I read, there's a time limit, right? So the call up can happen in a 10-day period after the approvals, but we won't know until we get notification from the city manager. So I just need to know what that looks like, because we're not doing that now. We haven't finalized our processes. So maybe somebody that knows more than me can explain how that works.
Jennifer, I think there was a suggestion made that it be included on the agenda of the items that could be called up. So there would be an official notification and click on that. But Jennifer, why don't you go ahead and address the question?
Thank you, Mayor Pro Tem. This is the item that we discussed at the coordination meeting, that as we move into the new policy and procedures, that this would be the trial run or the pilot project to see how well, in fact, it worked. So again, it was parallel to what the call-up provision was going to be as we walked into kind of the refresh of planning and zoning. And this was the first project that we wanted to try the capability to see if, in fact, with that call-up procedure, and of course, by adding it to the agenda, that would be the heads up to council that there is something identified after the group had walked through what the architecture plans looked like, whether they matched, whether they were in alignment with what council had given to staff in prior conversations.
You're muted. Mayor Pro Tem, you're muted.
Sorry. It says here upon receiving the manager's statement and no later than 10 calendar days after the date of approval. That doesn't say agenda. So what agenda are we talking about? Are we supposed to be looking at P&Z agendas now?
No, I think the intent was that in the city manager's report, that the city manager on the agenda, that it would be reported what items that are within that 10-day period. And so it was suggested, I think it was Councilmember Grimm suggested there was a way to formally notify us and the public through the agenda, and this would be the city manager's report, that it would specifically identify what items are within that period.
Okay, so if it's in the manager's report, we'll get.
That was, yeah, I mean, that was the suggestion.
It's a suggestion, so there's no plan in place yet.
Well, city manager.
So I think the suggestion came from Councilmember Anderson this evening, that it would in fact be a separate item and wouldn't be in the CMO report and thus wouldn't be lost, but it would be a separate email. And not only an email, but it would in fact be on the agenda. So it would be calling it out and council wouldn't have to look for it.
Calling it out where? I'm really confused now because I've heard now CMO report, update, and agenda, and I just need to know what this process looks like before I agree to it.
And thank you, Mayor Pro Tem. So we're adapting from 3 different council member comments on how to make it work tonight. So we're moving right along with you on how best to communicate this. If Councilmember Anderson, she provided some a thoughtful, comprehensive idea that from a staff perspective, we all said that's a great idea in order to get that out. Councilmember Anderson, would you mind restating that for us, please?
Sure. All I stated was that there needs to be some type of affirmative, like we all need to. I don't want to get lost anymore, so I did not indicate a specific place, just that I want to make sure that we see it and we acknowledge that we've I don't want to lose this one. That's all. So no specific place. That's all. That's all I had. Thank you.
Okay, well, I'm not against the idea. I just really feel like we need to have a process. Because otherwise, we're agreeing to something we don't even know what we're agreeing to. Is that fair? If there's no process in place, how can we know that it's going to work?
How about if we recommend that if in fact, when this occurs, that we will, outside of the email, so not in the CMO update. There's just too much that occurs on those CMO updates, and being appreciative of council's time. So from Anna's perspective, if it's within that 10 days, you all will receive a separate notification, and the subject line will indicate the specific project, the bullets of what it is, what it should be, and what our concerns are, if any.
And so you would be sending us an email?
Yes.
Okay. Well, we do get a lot of email and things get missed, so I think there needs to be a contingency. Because the clock starts ticking as soon as they make their decision, and then we have a 10-day limit to call it up. So I don't think this was fleshed out. I'm not against the idea. I like the streamlining, I like the time saving, but I don't think this process has been fleshed out. And I would feel more comfortable if it was. And I do support Councilmember Lim's proposal to increase the informed consent radius. It's not that asking that much. It doesn't do any harm, but it does ensure that people deciding to live near an oil and gas know that they're doing it. And I don't think that's asking too much. We're not trying to limit your development, but we do ask that as many people that can be informed and know what they're buying would solve a lot of problems, because that's a big issue right now, because there was no informed consent and there was no requirements to let people know. And I really want to change that. Now that we know better, we do better. And yeah, those are my thoughts. I'm just a little hesitant. I think it would be a great trial run to try the call up with McWhinney, because I do trust their product and everything that they've done with Baseline so far. But I want the process to be clear, and it didn't sound like it was. Thank you.
Okay. Councilmember Tessier.
Thanks. These are really good comments. Something that's coming up for me is that when we call a special meeting or whatever, the clerk will say, please respond. And so maybe if there are no responses from a particular council member, there's like a call or something that goes out. Because even though we get a please respond or must respond by noon, if you're like out, you won't see it before noon. So I don't know if it's a text. It could be a text or a phone call. And I think that texts for sure, along with the email, could really shore up a way to I guess, alleviate any of the concerns fellow council members have shared. I think there's a way to do it. And quite honestly, I feel like Kyle's been at every meeting we've had for the last 3 months. So I think we're going to see him again. So I just, and I don't want to make light of the seriousness of, this trial, this pilot, because I think that while I appreciate it, I think I don't want to miss it. And I think those who have, I could easily miss it. I'll just put it that way. So a text would actually be really good for me. And maybe there's a preference that each council member has, but and
Councilmember Tessier, thank you for that. And so from a staff perspective, until we iron it out, we will guarantee that we will be in touch with each one of you by some method to ensure contact.
like contact, yes, and like a reply from the council member. The council member has to equally kind of contribute and say, yes, I got it, thank you very much, whatever it might be, and then, you know, get back within that time. So that's kind of all I had. I think there were really great questions that were asked tonight. I don't have others.
Okay, I'm going to go to Councilmember Henkel next, and understanding that Schaff has his hand up. I don't think she's spoken yet.
Thanks, Mayor. Yeah, I heard all these questions tonight, and I had the questions about the schools too. So thank you, Councilmember Anderson, for asking that question. As far as the call-ups go, I remember we talked about this a few weeks ago, and I said, let's put it on something that's really consistent each week. If it means that we need an email, and then I even think something on our calendars that gives us a deadline. I just want us to, you know, always look at our calendars, and we could put the deadline for that specific project along with the link to that project in that deadline, and, you know, ways to call it up. So I think, you know, I remember talking about that we, you know, should have something that's consistent that we're always looking at. So, and as far as informed consent, I'm hesitant to do it project by project. I feel like we need to make, if we're going to make a decision, we should make it a specific decision for all of Broomfield. If McWhinney's willing to do it, I would really appreciate it, because I respect Councilmember Lim's, you know, comments in this. But I really do want to advocate that this should be for, you know, all development. And so I think that's, you know, important to me to make sure that we're being fair to our developers. And that's it for tonight. Thanks.
Councilmember Schaff.
Thank you, Mayor, for letting me go again. So, you know, Mr. Harris, you talked about, you know, advantage and disadvantage to your project versus other projects. And I think by, you know, with this call-up feature and by including that with this proposal and with this approval tonight, I do think that it disadvantages other projects and it advantages your project. And I really do think that this call-up feature needs to be separate from the approval tonight, that while this may be the test run for it, and maybe that's a staff and council decision, it should not be tied to the approval of this project tonight. That's my opinion. So, you know, if I'll be making a substitute motion to, you know, to remove that that caveat with this this proposal tonight. But, you know, I would like to see this project go forward. And I would like to see it go forward with the 2,000 foot notification that Councilmember Lim brought up. I do think that that is something that I'm going to continue to advocate for the rest of Broomfield as well. I do think that that's very important. We've seen studies on the effects of oil and gas up to 2,000 and beyond. So I think 2,000 foot is a minimum for me, and I will continue to advocate for that throughout the rest of Broomfield. So I'd like to see that included with this proposal tonight and approval tonight. You had talked about the plugging in and abandoning of these wells and the agreement that you had with Extraction. Is the plugging in and abandoning, is that tied to when the drilling of those mineral leases happen? So, for instance, will these wells be plugged and abandoned when the drilling of the United Pad happens and when the Northwest A and B happens?
I'm going back into memory a bit, but my recollection of our agreement that we have with Extraction Oil and Gas is that the plug and abandoning deadlines are hard and fast deadlines. They are date certain.
Okay, that's good to know. That was something that gave me a little bit of worry, is that those weren't going to be plugged and abandoned until those mineral releases were drilled on the United and Northwest pads. Because if that was the case, that timeline may be pushed out as those aren't being drilled at this point. So I'm glad to hear that those are hard and fast, and those wells will be plugged and abandoned.
And if I can, Councilmember Chef, I apologize. I just got notification from others on our team that all the wells have been plugged and abandoned north of 160th on baseline property.
All right, so we need to make sure that COGCC updates their maps on this. Great. We'll put in an email, I'm sure. And so I appreciate this project. Again, I will make a substitute motion. I think perhaps along with Councilmember Lim for the 2,000 foot notification, along with the removal of the kind of call up procedure.
If I can, just in the interest of consistency, I would suggest that if the desire is not to have the call-up provision because it unfairly advantages us, it seems that to be consistent to then say that there is a notification requirement for 2,000 feet, which is only on us, similarly seems to bring up that a little bit of inequity there. So I would just offer that up as, it seems to me there would be one or the other, but again, it's ultimately council's decision.
Fair enough.
Okay. Councilmember Anderson.
Thank you. And actually, I was just going to confirm what Kyle Harris just said. I was, while we were doing this meeting, I was actually on the COGCC website, zooming around there. And yes, there is no wells that are not plugged and abandoned. So it does confirm what you were also saying, that, and I think those are dark green dots and not light green dots. And so I think they actually were plugged and abandoned I think that is all consistent. And I do want to note that I don't think there's going to be much of a change for a 2,000 foot notice versus a 1,320 foot. If you look at where all those wells are located, but it is a bigger council discussion that we need to have after this experience with the Davis 436 well. I think we understand the difficulties that we run into with these plugged and abandoned wells. So I do support that. But I still, if you could, Mr. Harris, if you could go over again the reasoning for the moving this faster and the call-up provision and the closing on homes and trying to help keep costs down. Could you reiterate what the benefit of this call-up procedure was and why you were requesting it? That would be helpful.
Sure. Yes, Councilmember Anderson. Certainly the time that it takes to get on agendas, and as mentioned previously, our experience with West Village is it takes about 3 to 4 months to get through the process as it currently stands, whereas administratively, we anticipate that would be 3 to 4 weeks. So that's the first piece. And I kind of hinted at this idea of, for our East Village neighborhood, trying to coordinate the closings on our builders simultaneously. And you may, well, why do you do that? Well, our infrastructure is so expensive, we need to get the revenues. This is maybe more information I should be getting, but we use revenues from the transactions, from these closings, to help pay for the infrastructure that is going into the ground. And if there is this 3 to 4 month period where you have different builders, that there's that much variability in the process, it is much more difficult for us to say, hey, builders, there's an administrative process that you can go through, and we have some reasonable expectation of closing you all at the same time. Without that, if it's subject to, as opposed to 3 to 4 weeks, 3 to 4 months, it is much more difficult to coordinate that. And you say, why is that important? Well, because one builder is not going to close and put their money in escrow if they don't know that we're immediately going and doing the infrastructure. It's kind of like we all need to have them together. Hopefully that helps.
Yes, that is helpful. And I still think that I can support that as long as we get this piece back from our staff that there's going to be some kind of an affirmative that they know that we did have that opportunity to review it. So I think it still hinges on that that piece and making sure that we are all prioritizing this and looking into it. That's my concern, that a date will slip past and then we will have missed out on an opportunity. That remains my main concern. Thank you.
Okay, I'll go with Councilmember Law Evans next. It's her first time.
Thank you, Mr. Mayor. I have confidence in staff's word and intent to make sure that we have a good communication process. With that in mind, I love the idea of a test drive of our new streamlined process. And I'd like to call the question if council so desires.
Councilmember Hinkle.
Thanks. I realize I did not even weigh in on the call-up provision, so I apologize. It's been a long day. I'm okay with doing a test run too on this call-up provision, and I think we can even over-communicate this time and see what really hits, and then make sure that we have something in our calendars that we can put a deadline on. But if we over-communicate at first, I think we'll be okay, and then we can adjust from there.
So, I mean, Councilmember, I'm not sure what you meant, Councilmember Law Evans, about calling the question. That means that you don't think the mayor should have a right to make a comment?
Well, Mr. Mayor, I would never deprive you of the right to make a comment, but how many agenda items do we have left? That's my main point.
Well, I'm still going to make a comment unless council says I can. So, council, can I make a comment? Okay. I'll go ahead. My comment basically is that the 2,000 foot, and we're talking about 2,000 foot. I think, if I understand correctly, from plugged and abandoned wells is Gene, is that what you're talking about as well?
Yes.
And I guess I wasn't aware. I mean, is the current regulations that have the 1320, does that include notification for plugged and abandoned wells as now? So that's a whole new concept, because plugged and abandoned wells, I mean, that's a real new harsh concept that needs to be debated by council. And so I think trying to put a 2,000 foot notification on that tonight for this project I mean, I just think we really need to discuss that. And I understand the problems with 43.6. And when I saw the trenching that they were talking about doing on the neighborhood, I was real concerned about that. I mean, what that meant. But I think we do need to address, and Gene, you and I have had a lot, or Councilmember Lemon, you and I have had a lot of discussions on my concerns about plugging wells that are legacy wells. And so I think that's a whole separate issue. I will say on the call-up provision and the test run, I will point out that if you saw the committee that McWhinney has, that's got one of my favorite people, Amy Yarger, on it, and Anna Bernzetti, that's different than any other project in town, at least to my knowledge. And so it's a great one to have the test run on it. So I'm just going to make those are my comments. Thank you, council, for allowing me to speak tonight. So we will so we'll go to council's proposed resolution number 2020-247. Will the clerk please read proposed resolution number 2020-247 by title?
Resolution 2020-247, approving the North Park filing number 2 replat D final plat, site development plan, and subdivision improvement agreement.
Is there a motion? Councilmember Lindstedt?
Yeah, thank you, Mayor. I move that resolution number 2020-247 be adopted. Is that right?
Yeah, yes. Councilmember Lyons?
Second.
Okay, is there any discussion? Councilmember Schaaf?
Thank you, Mayor. I do have some discussion and then a substitute motion. So I just wanted to clarify with Councilmember Lim, when you were talking about a 2,000 foot notification, that's from all wells, or is that from all active wells?
That's from all wells.
Okay, great. So I would like to make a substitute motion. This would include Councilmember Lim's notification. So it would be that, pardon me, I just lost my page. I would move that resolution number 2020-247 be adopted with a 2,000 foot notification for all wells, as well as the call-up provision be removed from from this proposal.
I second.
Okay, Councilman Lim seconded. So any discussion on the substitute motion? Will the clerk call the roll?
Groom,
No.
Hinkle,
No.
Jezierski, Law Evans,
No.
Lim,
Yes.
Lindstedt,
No.
Schaaf,
Yes.
Tessier,
No.
Anderson,
No.
Castriata.
Yes.
We missed Stan.
Dan, did you vote? I didn't hear you.
Voted, I said no.
Okay. So it fails 7-3. We'll go to the original motion. Is there any further discussion in the original motion that 2020-247 as drafted be adopted? I will ask the clerk to call the roll.
Hinkle,
Yes.
Jezierski,
Yes.
Law Evans,
Yes.
Lim,
No.
Lindstedt,
Yes.
Schaaf,
No.
Tessier,
Yes.
Anderson,
Yes.
Castriata,
No.
Groom.
Yes.
So it passes 7-3. Correct? Samantha?
7-3.
7-3.
Okay, it passes 7-3. So we'll move on to agenda item 11B, which is the public hearing of proposed ordinance number 2145, extending the temporary moratorium on applications for use by special review or operator agreements to allow development or operation of oil and gas wells or facilities within Broomfield. I will declare the public hearing open. We will follow the city standard public hearing procedures as previously stated. Council has a copy of the agenda memorandum, which staff will summarize.
Mayor and City Council, Sean Sullivan, City and County Attorney. On April 16th of 2019, last year, Governor Polis signed Senate Bill 19181 into law, which authorized local governments to exercise additional regulatory authority over oil and gas operations without being preempted by state law or regulation. In order to develop new regulations to implement Senate Bill 181 in a thoughtful manner that provides more clarity and certainty to oil and gas operators about Broomfield's requirements without trying to simultaneously review and process applications to develop oil and gas wells, facilities, and projects, Broomfield determined that a temporary moratorium on processing such applications was necessary. For the past 18 months, staff has worked diligently creating a public process, scheduling public workshops and study sessions, researching regulatory options, and drafting regulations. The process of drafting, reviewing, and revising regulations is ongoing. On May 12, 2020, Council adopted Ordinance 2123, which approved changes to the zoning code regarding oil and gas development and adopted a 2,000-foot setback. On May 26th of 2020, Council adopted Ordinance 2125, extending the moratorium to December 4th of 2020. Although the temporary moratorium has given us a chance to draft needed amendments into the oil and gas and other land use regulations, the COVID-19 emergency has delayed regular City Council business and the business of the COGCC and requires additional time for staff to develop complete revisions to the new regulations and present them to City Council for its consideration. An additional 6 months is recommended to provide sufficient time to finalize oil and gas and land use regulations as authorized by Senate Bill 19-181. Ordinance number 2145, which is under consideration, if approved on second reading, will extend the moratorium up to and including June 4th, 2021. That completes staff's presentation.
Thank you. We will proceed with public comment. If there's anyone who would like to be heard, please press *3, state your first and last name and neighborhood for the record. I'm not noting anybody in the queue. Mayor Pro Tem, is there anybody trying to get into the queue that you can see? No. Okay. So we will go to council member comments and questions next. Is there any member of council has any comments or questions? Please raise your hand and I will recognize you. I'm not noting any comments from council, so I'm going to say close out the public hearing. There be no further comments. The public hearing before the City Council is closed. Next is council's consideration of proposed ordinance number 2145. Will the clerk please read proposed ordinance number 2145 by title?
Ordinance number 2145, extending the temporary moratorium on the processing or approving of any applications for use by special review or operator agreements to allow the development or operation of an oil and gas well or oil and gas facility.
The Access Live event is in music hold. Music hold ended.
Okay,
Within the city and county of Broomfield, in order to evaluate and adopt updated regulations as authorized under Senate Bill SB 19-181, second reading.
Is there a motion? Councilmember Anderson?
I don't know what's going on.
Yes, that ordinance number 2145 be adopted on second reading and published by title.
Is there a second? Councilmember Lim?
I second.
Okay, is there any further discussion? Will the clerk please call the roll?
Jaworski?
Yes.
Law Evans?
Yes.
Lim?
Yes.
Limstead?
Yes.
Schaff?
Yes.
Tessier?
Yes.
Anderson?
Yes.
Castriota?
Yes.
Broom?
Yes.
Hinkle?
Yes.
It passes unanimously. We will move on to 11C, which is the public hearing and council consideration of proposed ordinance number 2143, creating a chapter in the Broomfield Municipal Code to temporarily cap third-party restaurant delivery fees within Broomfield. I will now declare the public hearing open. We will follow the city standard public hearing procedures as previously stated. Council has a copy of the agenda memorandum, which staff will summarize.
Thank you, Mayor and Council. Christine Franciscani will walk us through this item. Christine?
The City and County Attorney's Office was asked to draft an ordinance capping the delivery fees charged to restaurants within the city due to the impact of the COVID-19 pandemic on the restaurant industry. As seating in restaurants has been affected by the pandemic, dependence on food delivery has risen, and high fees may affect the ability of restaurants to continue to be viable. When a consumer orders food through companies like Grubhub, Uber Eats, DoorDash, and Postmates, there is a fee that is charged directly to the restaurant. So Broomfield's proposed ordinance limits those delivery fees charge to restaurants to 15%, and also prohibits reduction in the compensation made to delivery drivers. Staff has been in touch with Grubhub, Uber Eats, and DoorDash, and these companies understand the reasoning behind the delivery fee cap. Staff also checked in with those companies again after the October 27th council meeting, and they provided no further comment on the ordinance. If the ordinance passes, it is set to expire on March 31st, 2021 in anticipation of warmer weather and return to outdoor dining. And if it is adopted tonight, it will go into effect on November 17th. That ends my presentation.
Thank you. We will now proceed with public comments. Molly, identify your full name and I guess who you're with, and you have 3 minutes.
Hi, good evening. My name is Molly Steineman. With the Colorado Restaurant Association. Since the council last heard this proposal, the need for this type of legislation has only increased. As you heard earlier, the transmission of COVID-19 is rampant across the state, and unfortunately, restaurants across the state and Broomfield specifically are seeing lower capacity limits, and they are being pretty severely impacted by public health orders. And the very unfortunate reality is that many restaurants will not make it through the winter at 25, 50% capacities. They just can't do it. It's an industry that in the best of time operates on 3 to 5% margins, and they simply just can't make it work with reduced indoor capacities. This temporary cap on the fees that restaurants pay to takeout and delivery third-party companies is incredibly important. It really just leaves cash in the pockets of restaurants who need every little bit right now just to make it through the fall and winter months. It's a reasonable measure. It's temporary. It really is just a temporary relief move that a local government can give to help their restaurateurs survive. So I would encourage a yes vote, and I would encourage your support of your local restaurants. Thank you.
Thank you. I'm not seeing any other comments or anybody else in the queue for this item, so we'll go to questions from council members. Councilmember Henkel.
Thank you, Mayor. I'll be really as quick as possible. I did just a little bit more homework because I was concerned about how much the restaurant owners and the restaurants were making, versus, like for tips, for instance. I wanted to know if the restaurants are receiving the tips or if just the drivers are receiving the tips. And the restaurant owners are telling me that not only do they not receive any tips, only the driver does, but people are adding them to their lists for food, and they are not being asked to be added to those lists. And so there's a lot of confusion with that. There's just a lot of pressure on our restaurant owners right now, and I can't try not to get emotional about it because 25% capacity for these restaurant owners, and they're not receiving the tips. That's really big for me. And I want to reiterate that we've had an increase in deliveries, and so these companies are making a lot of money right now. And so to cap it at 15%, I think is going to be important. And I know a lot of people say it's not a role in government. Well, it's our role in government right now to help save lives. And that role, we had to step in. We had to step in to save lives. And so in order to step in to save lives in that regard, we have to make sure that we counterbalance the lives of those workers and those restaurant owners. We have to make sure that we can do everything that we can to ensure their longevity and so they can see it through the winter. So thank you.
Councilmember Anderson.
Thank you. We received a couple of emails on this, and I just want to clarify that that there is, I'm not sure how this happens, that some of these restaurants don't even have that chance to weigh in, but this is putting a cap that is not to exceed 15%. However, the very next sentence says, the provisions of this section shall not limit the ability of any retail food establishment to choose to pay a higher commission. So I read that to mean that if I'd like clarification on this, but if this food establishment wants to, they can actually pay a higher commission on this, because I did not realize this practice was even going on, and that this cap shall not reduce the compensation rates paid to the delivery service driver, and it's only temporary. So I just want to reiterate those points, that this is not limiting that they can still add on additional cost, whatever it costs to deliver it. So I think I just want clarification that really is indeed the fact that they can pay more than 15% if they want to, and then beyond that, it's like, they can add on whatever fee it takes to deliver the food. This is not stopping them from making money. And is that a correct interpretation?
Councilmember Anderson, you are correct. So if a restaurant does wish to negotiate a higher fee, they would still be allowed to do that.
Okay, thank you very much.
Councilmember Jaworski.
Thanks. I'll just to hit that one really quickly. Honestly, any restaurant's not going to negotiate to get a higher fee. Just like no one's going to negotiate to be closer to an oil and gas well. So I'm not sure if that's means a whole lot. But, and I'm sorry, Laura, I don't mean to. I mean, it's just a thought there. But I mean, this is I super understand the reasoning behind this. This is a tough one for me. Because I get what everyone is saying with the need to help our restaurants. There's no doubt that this is going to be a ridiculously tough 4 to 6 months for them, and I'm super sympathetic to that. Just not sure this is the right way to be going about doing it. I do have one question. I don't know if Jeff is here on the line or mine or not, but I did have a question about what the actual impact of this would be. So I get it's a fee reduction, but what does that really mean or translate? I just started thinking about that, and I'm not sure that's been mentioned. Is that dollars? Yeah.
Council member, if you wouldn't mind, I was being elevated in, and so I missed part of your question. So if you could repeat it.
Yeah, pretty simply, I was just wondering what the actual impact of this is going to be. So how much are the restaurants going to be saving on average? Are we talking, single dollars? Are we talking hundreds of dollars? I mean, how much, I'm just wondering, how big a deal really is this?
Mayor Pro Tem and council members, we don't have a specific number, but we can all do the kind of the math of it. A 15% fee, we're being charged at 25%, which is what we've oftentimes heard was the fee that some restaurants have been paying. So if it's a 10% reduction on we'll call it an average $35 bill, that'd be $3.50. If they were doing, 20 or 30 of those delivery bills or delivery services per night, then you're going to end up in $100 plus in savings to the restaurant. While that seems somewhat immaterial, $100 times 25 nights, it will add up to be $2,000 or $3,000. And that's just a smaller size restaurant. And oftentimes the restaurants we're really talking about. And so that $3,000 or so in additional revenue, because again, remember, this is at the cost level of the restaurant. And so that it's going to be one more thing. And that's what's really important in all of this, is this is not the only thing we're trying to do. As you know, we have enhanced Broomfield. We're doing other things, including expedited outdoor seating reviews and other things. But this is that one more thing for another $2,000 or $3,000 to the average restaurant. And that's a rough estimate, but that gives you a kind of a scale of what we think the effect would be.
Okay, no, I appreciate that, and of course, someone may have more savings, and some may have less. But I think okay. So I mean, yeah, I agree. If it's a few $1,000s, that would be real. I'm not sure it would save a restaurant that's going to go under, but that's real money though, and I would never say that it isn't. So I mean, I don't know if I'm going to definitely think about that one. I'm not sure that's going to change my mind. Ultimately, I understand again that the restaurants are going to be facing a tough winter. I totally agree with that. I will mention that we did hear earlier tonight that there is a light at the end of the tunnel, which is good. That there is hopefully a vaccine coming fairly soon. So this need should be fairly short-lived, and 4 to 6 months maybe, I guess, is what we've been hearing. So I think that's a good thing. And Jeff, as you mentioned, what I really do advocate for is some of the things that we're already doing, whether that's additional stimulus money from the federal government, whether that's the enhanced Broomfield money from us, specifically something from the state. I mean, those things I could get behind. I get that we're putting very draconian restrictions on our restaurants right now, and they need to, we need to help them. And I think for me, that's the way to go about helping them. I have a significant concern still, about sort of overreaching into this a private, relationship between a delivery company and a private restaurants. And it's, I get it, Uber Eats, whatever, all that. I don't know if any of these other companies, Grubhub. I get that they're not sympathetic characters, by any means, and the restaurants are. But I also, just want to stress that this is a delivery service. It's not a necessary service for the, for the restaurants or for the consumers. And there's not a monopoly. There are a number of different entities that are out there that provide this service. That's my understanding. So, I'm really, it's really something for the if the restaurants can't afford to pay this, then they're not going to use it, and then the market will adjust to that, and the prices will go down. Similarly, other companies can come in and offer this own service. The restaurants themselves can offer delivery service. So I'm just not sure why we need to really get involved in this particular sort of private transaction. And then also, and I think this has been mentioned, it's not really a consumer issue either. There's something that affects the restaurant. It's not going to make the food any cheaper for the people that are actually using the service to have the have their food delivered. So I get the reasoning. I'm just not sure this is for me at least, not the way to go about saving our restaurants. I certainly do want to do anything we can to say that it's necessary. This is the right thing to be sort of delving into. So it is real money. I'll continue to think about it over the next few minutes, but at this point, I'm hesitant to be a yes vote.
Councilmember Lindstedt.
Thank you, Mayor. I did want to clarify a couple things. The negotiation to pay higher fees isn't to negotiate to pay higher fees like other council members maybe think. It's in case they want to pay for extra advertising services. So say you want to partner with Grubhub and pay more money, have a higher fee, but they put you at the top of the menu or whatever. I mean, that's why that language exists. So it's for add-ons, so that they have restaurants and these third-party delivery companies have leeway to make those deals. This is for the base service of just delivery. And I did want to push back a little bit on the discussion about monopolies. These are mostly large tech companies based in San Francisco, and they are consolidating. There are less and less of these large national third-party delivery companies right now. Two of the largest ones are negotiating to consolidate again. So, it's a shrinking field, and there's a lot of it takes a lot for the public to know which companies provide this, and they're household names at this point. So it's very hard for a local restaurant to break in and provide their own in-house delivery when they're competing with companies that are on television all day and advertising, and that have become such well-known things, and people don't understand that those services make it very, very hard for restaurants to make money. So I think this is a very reasonable restriction to put on an industry that is doing on a service that is doing remarkably well given the pandemic. They are benefiting immensely from the current situation we're in, especially while we're limiting restaurants to 25% capacity, or there the state is. There's no way these restaurants are going to survive, and delivery has become a necessary service. And these large third-party delivery services have take up so much of the volume when it comes to delivery that I think it's very reasonable, and it ends at the end of March. This is not a permanent ordinance. This is literally to help our restaurants during during a once in a lifetime, hopefully, knock on wood, pandemic. So I think it's very reasonable. The restaurants clearly want it. The last thing I wanted to touch on we're not the only ones in the metro area doing this. Denver passed it. Aurora, the most conservative member of the Aurora City Council, is actually carrying the same ordinance. There, Durango is considering it. Wheat Ridge is considering it, and Boulder and Longmont are considering a slightly different version of this. But there's a lot of local governments looking at regulating this stuff just for this year, in Colorado and across the country in some form or another. So I just want to lay that out there for folks to think about. But I'm excited about this ordinance because I think it'll help our local restaurants survive this very, very trying time. Thank you, Mayor.
Councilmember Lamb.
I agree with everything that Councilmember Lindstedt just said, that this is a temporary measure that is needed under extreme circumstances to keep our local restaurants in business. I appreciated what Economic Director Romine said, that there are needed a variety of measures to keep these local restaurants afloat. I noted that the Chamber and the Broomfield Community Foundation just partnered to create the Broomfield Small Business Fund. That's one such avenue that these local businesses have to keep in operation. Again, I stated last time, I look at this from the perspective of the workforce and my assignment to the Workforce Center Board. What I'm hearing is that there is a large proportion of restaurant workers who are unemployed, are under long-term plans to upscale their skills, but that's a long-term plan. They need to feed their family right now. And this is only over the next 4.5 months, but it may keep these people employed in our local businesses. Thank you.
Councilmember Law Evans.
Thank you, Mr. Mayor. This certainly is an emotional issue with regards to the restaurants in town. There's a lot of wonderful restaurants that are really struggling during this time. I think we all know that. But I agree very much with Councilmember Jezierski's comments in that I'm not sure why we're picking this particular relationship to get in the middle of, other than that it's new. It is kind of the wild, wild west to a certain extent. But I am really not comfortable getting in the middle of that relationship, especially because it is a relatively new industry. I don't have a sense, and I haven't heard anyone discuss it, as to the unintended consequences of this. Councilmember Tessier did talk about this when we had the first reading on this a little bit, in that many people that were employed in the restaurants are now driving for these delivery services. And in the gig economy, they've simply shifted where in the restaurant, where in the food service industry they are. So I really don't have a good sense for what the unintended consequences of this would be. And I'm really, really hesitant to get in the middle of this. I would much rather see proactive support of our restaurants, such as, I think there's no end of potential ideas. I tossed out one last time that maybe we all should get together and do a virtual meal before we have our council meetings. I heard, I think on Nextdoor or something like that recently, someone putting together a virtual progressive dinner for neighbors or friends within town. I don't know how it worked, but it sounded like a neat idea. We could even, I know this is a radical idea, but we could even encourage people to pick up their own meals from the restaurant on their way home from work, which, let's face it, would also save traffic and burning additional fuel, et cetera, with just a little bit of planning ahead. So I'm very hesitant to put this into play. I will notice from the consumer advocacy end of this discussion, as I sent out an email to council about a week ago, I think, there are credit card companies, specifically American Express, that are forging partnerships with these folks. And if you have, I'm not sure it's any American Express card, but certainly the one that I have, you can sign up for a year's worth of membership. I think it's to Uber Eats complementary of American Express. So from the consumer aspect, that end of it is being taken care of by the free market to a certain extent. That doesn't mean that the restaurants are seeing any more money, but on the other hand, if that partnership between American Express and Uber Eats encourages people to buy more meals and have them delivered, maybe the restaurants can survive longer. So that's the premise I'm working on. But as much as I want to help our restaurants, I'm going to be a no on this. Thank you very much, Mr. Mayor.
Councilmember Schaaf.
Thank you, Mayor. So I was really hoping that we would have some representatives from Uber Eats or Grubhub or any of those third-party delivery services. And part of it's, clarification from them. So, some of my questions I have, and maybe some of these are for staff, I'm not sure who can answer them. So a restaurant has an option to sign up with a third-party delivery service. Is that not the case? They aren't forced into an agreement.
Mayor and council members, oftentimes these services also will list menus and list restaurants. And sometimes the restaurant doesn't know that they are being marketed for on behalf of them. And that has happened with some of the cases. In other cases, though, the Uber Eats, Grubhub, and DoorDash will actually enter into agreements specifically stating both for advertising and marketing support as well as other things. And that may include then the delivery service. So in some cases, delivery service is being done without their effective knowledge, and then the bill is coming. And that has been one of the consumer complaints that has been voiced because oftentimes then the menu that is being offered through these services won't necessarily align with the current menu, and that's been expressed a couple of times.
But it doesn't seem like this ordinance necessarily takes care of that. That's a concern. It's a concern that that Uber Eats or any of those third-party delivery services are basically signing up restaurants, collecting fees from consumers and the restaurants themselves without any agreement by the restaurants. That seems like something we should take care of, but it doesn't seem like this is necessarily taking care of that issue. They're still going to do that. They're just going to do it at 15% instead of a 30% markup.
You are correct in that. It is something that one of the services, when we talked to them, expressed if that was something that we wanted to also take on. And the feeling was that was beyond what the council had proposed for us to consider within this ordinance, was whether we wanted to regulate a further relationship or a transaction that may be between two parties or not. But that was not the direction that we were given by council as we began this process.
Well, it seems like that we should be taking care of more of the consumer protection aspect of this, by the kind of more predatory third-party delivery services on restaurants and on consumers, as opposed to getting involved in a possible negotiation where the restaurant has the ability whether to sign up with a third-party delivery service or not. They're aware of those delivery charges and the commissions that are going to be taking place. And that is an agreement that they're signing up. It also seems that the customer themselves receive adequate notification what the delivery fee and the tip fee are going to be for that delivery service. Is that not the case?
Again, Mayor and council members, so this part of the fee, there is a fee that the consumer pays.
Mm-hmm.
They do have the option if they would like to make a tip. That is a voluntary transaction also between them and the driver. But this is a fee that's on the restaurant that is not paid for by the consumer in a direct manner like you're talking about. So in effect, what is happening in this relationship is the restaurant is paying a delivery fee and the consumer oftentimes is paying a delivery fee and then a tip on top of this.
Okay. All right. Well, I think that I think that this is we've kind of I don't think we're going down the right road with this. I think that we're not necessarily taking care of the consumer protection problem with this, whether it's the restaurant or whether it's the individuals. We're kind of just putting a I don't know, a Band-Aid on a flesh wound at this point. There is a problem with the restaurant industry right now, and there's a major bleed with the amount of kind of restrictions that are on them right now and the capacities in which they can have in their restaurants. This is basically putting a Band-Aid on that flesh wound, which is and as you said, Mr. Romine, that there are a lot of different strategies in which we need to take, and we do need to take those. But this isn't necessarily, in my opinion, the strategy that's going to help most. It's what the idea of ensuring that these third-party delivery services aren't taking advantage of the restaurants during this time, I think is something that we do need to take care of. We should not have, be having third-party delivery services imposing extra fees on top of these restaurants without their consent. And that is something that we should take care of. And we should ensure that the notifications are adequate on consumers when they do purchase through these third-party delivery services. So I'm going to be a no on this ordinance tonight.
Councilor Lindstedt.
Thank you, Mayor. Briefly, I would note that the third-party delivery services were reached out to, and they did not send an email or attend this meeting. They were aware this is happening. They were aware during first reading and during second reading, because this ordinance is very similar to the one in Denver, which they were very involved with and stakeholdered, and those unintended consequences that people have mentioned. They're not worried about. I mean, they don't like the ordinance, but they're not here fighting it. So that should speak for itself. I mean, we shouldn't expect them to come and fight against an ordinance because they're not here in opposition to answer questions. I think that's they had their opportunity to come here and they're not here. Second of all, I would love if council members would bring forward ideas to help our restaurant industry. This is one Band-Aid that I brought forward as a way to provide that $2,000 to $3,000 a month to restaurants that they desperately need. So I think if other council members have better or different ideas, I think they should certainly bring that forward. This is just one tool in a very full toolbox. We've given out $2 million to local businesses impacted by the pandemic. So I don't really understand, don't let perfect be the enemy of the good. This ordinance will save, our local restaurants thousands of dollars a month. They are asking for it. So we have a limited time here to get something through that will hopefully help some of these restaurants during this very hard winter. So, we're working in strange and extraordinary times here. So I don't think we can workshop all of these ordinances to be absolutely perfect every time. But a Band-Aid's better than nothing. So that's all I've got to say, Mayor.
Thank you. Not noting any further comments. The public hearing before the city council is closed. Next is council's consideration of proposed ordinance number 2143. Will the clerk please read proposed ordinance number 2143 by title?
Ordinance number 2143, creating Chapter 5-41 of the Broomfield Municipal Code to temporarily cap third-party restaurant delivery fees within the city and county of Broomfield. Second and final reading.
Councilor Lindstedt, I was hoping you put your hand up.
I was going to see if anyone else wanted to, but I move that ordinance number 2143 be adopted on second and final reading and ordered published by title.
Mayor Pro Tem.
Second.
Is there any further discussion? Will the clerk please call the roll?
Law Evans?
No.
Lim?
Yes.
Lindstedt?
Yes.
Schaaf?
No.
Tessier?
Yes.
Anderson?
Yes.
Castriata?
Yes.
Groom?
No.
Hinkle?
Yes.
Jezierski?
No.
So I have it passing 6-4. Samantha?
Yes, Mayor, 6-4.
So So we'll move on to 11D, which is council's consideration of proposed resolution number 2020-260, authorizing and approving an agreement between Broomfield and Broomfield Fish for supplemental funding. Before we begin our conversation on this item, I want to recognize Councilmember Tessier for a point of personal privilege. Councilmember Tessier.
Thank you, Mr. Mayor. Yes, I'd like to ask for that personal privilege and let you all know that I am a staff member at Broomfield Fish and I must recuse myself, and I'm hoping that someone will give me a holler when I can jump back on and rejoin the meeting.
Yeah,
Thank you.
Yeah, Jennifer, I think we agreed that somebody was going to text her when we're done. Has that all been set up?
Perfect.
It has, Mayor.
Okay, you'll be texted
Bye.
when you can rejoin. Thank you. Council has a copy of the agenda memorandum, which I'll ask staff to summarize.
Thank you, Mayor and Council. Dan Casey, Director of Health and Human Services, will walk us through this brief item. Dan?
Thanks, Manager Hoffman. Good evening, Mayor, Mayor Pro Tem, and members of Council. Dan Casey, Director of Human Services. Wanted to quickly go through the presentation for the proposed resolution for supplemental funding for Broomfield Fish. The 2021 Council priorities include housing-related initiatives. In support of those initiatives and to prevent more profound housing issues related to the effects from coronavirus pandemic in the months to come, staff proposes that supplemental funding be provided to Broomfield Fish. This recommendation is made so that timely essential services can be provided to vulnerable Broomfield residents who have been impacted by COVID-19. As you know, Broomfield Fish is a Broomfield nonprofit. They are the only nonprofit in Broomfield that runs a food bank and a family resource center specifically serving Broomfield residents. Fish provides emergency basic needs services for low-income residents to assist them moving towards self-sufficiency. Some of those services include direct financial assistance, keeping families housed, emergency hotel voucher program, healthy foods, and support, mentoring, and referrals through their Family Resource Center program. If this proposal is approved, the Fish would receive $100,000 in supplemental funding to help meet urgent community needs. As part of their spending plan, they broke down the $100,000. $20,000 would go to preventing hunger, $40,000 would go to emergency financial assistance, $30,000 would go to keeping families housed program, and $10,000 would go to the emergency voucher, hotel voucher program. And I just wanted to also note that this supplemental funding that's being proposed on this resolution is separate from the nonprofit money that is part of the normal human services grant process. And that concludes my presentation.
We'll go to the public. Does any member of the public have comments on this item? If there's anyone who would like to be heard, please press *3. State your first and last name and neighborhood for the record. I'm not noting anybody in the queue. Nope. So we'll go to council member comments or questions. Council member comments or questions. We will we'll go with the consideration of proposed resolution number 2020-260. Will the clerk please read proposed resolution number 2020-260 by title?
Resolution number 2020-260, authorizing and approving an agreement by and between the City and County of Broomfield and Broomfield Fish for supplemental funding.
Is there a motion? Mayor Pro Tem.
Thank you, Mayor. I move that resolution number 2020-260 be adopted.
Councilmember Law Evans.
Second.
Is there any further discussion or any discussion? Will the clerk please call the roll?
Lim?
Yes.
Lindstedt?
Yes.
Schaaf?
Yes.
Anderson,
Yes.
Castriata,
Yes.
Broom,
Yes.
Hinkle,
Yes.
Jezerski, Jezerski,
Yes, sorry, you're not hearing me. Yes, 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 yes.
Three votes.
Law
for-
Evans.
Yes.
Early, vote often.
Okay, so it passes unanimously. Jennifer, would you text Councilmember Tessier and let her know that she can rejoin the meeting?
I did, Mayor. She's calling in now.
Okay, thank you. So I'll go ahead and get started on. I'm speaking slowly here, waiting for her to come on.
There she
Yes,
is.
she's on. So welcome back. Next is council consideration of proposed resolution number 2020-259, authorizing and approving an intergovernmental agreement between Broomfield and Boulder concerning cost sharing for temporary shelter housing. Council has a copy of the agenda memorandum which staff will summarize.
Dan Casey, Director of Health and Human Services, is going at it one more time for a very brief introduction, approving an IGA for our COVID shelter. Dan?
Thanks, Manager Hoffman. Yeah, Dan Casey again, Director of Human Services. And just quickly, I will present the proposed resolution authorizing the intergovernmental agreement for a COVID-19 recovery center. The purpose of this agreement is to provide people experiencing homelessness who have COVID-19 positive or symptomatic or who are COVID positive or symptomatic a place to isolate and receive supportive care. The City and County of Broomfield Public Health and Human Services will work together with our community providers to identify affected individuals and provide COVID-19 testing if necessary. Some of the services that are provided at the CRC or the COVID-19 Recovery Center include 3 meals per day. This IGA does not include transportation, so that will be provided by our police department in the detention center. And then this facility is staffed. I know we talked about the Jefferson County IGA, I believe back in June of this year. This facility is different from that in that it's not necessarily a non-congregate shelter, but more of a congregate shelter. And they don't provide medical services on site. They do have medical reserve corps that will visit regularly, and they also can refer to hospitals. But this care site is not for folks that would need to be hospitalized. It is for folks that will be not requiring hospitalization or being stepped down from hospitalization. The cost of this care site is $110 per night, and Broomfield is not billed or not charged if we don't use the site. So it's only for times when we're using the site. And if approved, the City and County of Broomfield will partner with the City of Boulder to provide shelter to isolate and quarantine eligible persons. And the shelter is provided, the CRC is provided for homeless located at 3485 Stanford Court in Boulder, Colorado. And before I conclude my presentation, I just wanted to give some credit to Dean Bennett and Kent Davies, who did the majority of the legwork in getting this IGA together. And Mayor, that concludes my presentation.
Thank you. We will proceed to public comments. If there's anyone who would like to be heard, again, the number is 855-695-3744. And please press *3 to state your first and last name and neighborhood for the record. I'm not noticing anybody in the queue or trying to get in the queue. So we will then go to council member questions and comments. Or next, Councilmember Lim.
I generally support this, but I did have a few hopefully quick questions. In the introduction in the memo, under close contacts, it says receive regular health care and assessments to determine if they require a higher level of care. And then when I looked within the agreement itself, I didn't see anything about that health care assessment. And I'm trying to reconcile, there was a difference within the memo, and then there's a little, I'm not sure how that even fits with what you just said, Mr. Casey, if you can clarify that.
Sure, Councilmember Lim, thanks for that question. So it's our understanding that on-site medical care is not provided, but that there is a rotating, let me make sure I get this language correct here. The Medical Reserve Corps provides regular visits. And again, this is not a medical facility, so those visits would be provided by the Medical Corps if they noticed something that they felt needed to be referred either for emergency, a 911 ambulance type of call, or if they needed to have that individual transported to the hospital. There are staff that would be able to make that call. Again, they are not there every day. The facility is staffed daily, so also the staff that are working in that location could potentially make those assessments. But again, this is not a medical facility.
Okay, thank you. Is there do we have any kind of ballpark estimate about how many residents we expect to use this service of Broomfield? And are there other counties engaging in this agreement with Boulder? Because there's a limit of 10 persons outside of Boulder County.
Yeah, that is correct. Again, thanks for the question, Councilmember Lim. When we did our initial assessment in earlier this year, we anticipated that we would potentially use the Jefferson County site with about 50 individuals. And again, that you said ballpark, and that's exactly what we did. We tried to figure out a ballpark number based on how many individuals we had that are experiencing homelessness, that are considered Broomfield residents, if you will, and then tried to extrapolate out what the positivity rate or the exposure rate was at that time, and that led us to about 50 individuals. But it's really hard to tell. It could be 5 or it could be 100. And again, you're correct. There's a limit of 10. If the facility is full, then each county only gets a maximum of 10 beds at this particular site. If you do quick math, again, just going through the numbers at $110 a day, and let's assume that it was 14 days. With all 10 of those beds full, that would be about $15,000. Again, all 10 beds full for 14 days is about $15,000. But yeah, there's no way for us to put an exact number on that. I think ballpark is the best we can do.
Okay, thank you very much. Those are my questions.
Councilmember Tessier.
Thank you. Just wanted to reiterate the shout out to Kent Davies. I know he's been working pretty hard and for a long period of time with different communities on figuring out where Broomfield could join some of our neighbors. So I really appreciate the work he's done on this, and shout out to Dean as well. I also wanted to just thank the City and County of Boulder for working with us and doing a pay-as-you-go versus charging us without maybe even using the beds that Jeffco that we were considering with Jeffco. So I really appreciate that perspective, and I'm grateful. I'm grateful for that. So and according to the database, some of the databases in some of the nonprofits, there's about maybe between 100 and 150 people who are experiencing homelessness right now in Broomfield, be it on the streets or in their vehicles. And I think that, getting the word out is going to be crucial. And I think that there's been a lot of work in the community with a lot of the different partners to have that coordinated care that will allow for a seamless process for this to happen. So I'm really excited about this, and I'm really happy to see that this is happening in our community. And thanks again, Dan. This is very great.
Councilmember Hinkle.
Thank you, Mayor. I want to echo Councilmember Tessier's comments, and then, yeah, just thank you for really looking out for our homeless population. I just had one question, just to know what capacity that it's at right now, and is there like a maximum amount? How does that work?
Yeah, thanks for that question, Councilmember Hinkle. I believe the maximum capacity of this facility is 60 beds. I don't know, I can't speak to what their current capacity is. They have a maximum of 60 beds, I believe, at this location.
Okay, and is there any indication from our health department that that might go up beyond the 60? I'm just curious in case we need a backup plan or anything like that.
I'm not sure. I would assume, based on the number of positive tests that we're getting, that that number would go up. But again, I don't know if the Boulder facility has 10 people there right now or 55 people there right now. We can circle back with them and find out what their current capacity is, and we can get that information back to you.
Okay, and is there a preferential, is it whoever gets there first, or if they're a Boulder County resident? Like if they stayed the night in Boulder County the night before, they're probably considered a Boulder County resident. Is there a preference or anything like that?
Yeah, they do have a preference for Boulder, City and County of Boulder residents. And they say that the other counties would get 10 beds. I believe that is guaranteed that we would get 10 beds of those 60. And I think right now we are the only other county that's partnering with them. Obviously, Longmont and Erie and the municipalities within Boulder County are utilizing the same service, but we're the only other county right now that's in an IGA situation with them.
Okay. I would just like to suggest if we could just keep those numbers in our numbers when we hear from the public health department, and just knowing how many is in this facility. I would appreciate it. Thank you.
Okay. Next is council's consideration of proposed resolution number 2020-259. Intergovernmental agreements require an affirmative vote of 2/3 of the entire council. Will the clerk please read proposed resolution number 2020-259 by title?
Resolution number 2020-259, authorizing and approving an intergovernmental agreement by and between the City and County of Broomfield and the City of Boulder concerning cost sharing for COVID-19 Recovery Center for temporary shelter housing.
Councilmember Tessier.
Thank you, Mr. Mayor. I move that resolution number 2020-259 be adopted.
Councilmember Hinkle.
Second.
Okay, is there any discussion? Councilmember Groom. Oh, is there any discussion? Will the clerk please call the roll?
Lindstedt,
Yes.
Schaaf,
Yes.
Tessier,
Yes.
Anderson,
Yes.
Castriata,
Yes.
Groom,
Yes.
Hinkle,
Yes.
Jezierski,
Yes.
Law Evans,
Yes.
Lim.
Yes.
Passes unanimously. So we'll move on to 11F, which is the city and county recruitment and selection process. I know Amy's going to be talking about the overall process. I did want to make a comment to the public that we did have an executive session between 5 and 6:10 this evening, which council did discuss this process. We're going to have a discussion and a vote on who we want to nominate for, and make an offer to for the city and county attorney this evening. It's up, Sean. I don't know, maybe right now, Sean, do you want to make a couple comments on what the rules are, since these are personnel matters, as far as council comments are going to be?
Sure. So your conversations among yourselves in the in the deliberations are, in the executive session, are things that shouldn't be discussed among you publicly, but if there were items on the applications or resumes of the applicants or the answers in their applications, those are all public matters now with the finalists. In addition, in the interviews, as you ask questions of the candidates, if they had information or gave you answers that influenced or provided a basis for you to help come to a decision about who to nominate or who you would like to serve as your next city and county attorney, those things can certainly be stated. Happy to answer questions if somebody has a specific question.
Does anybody have any questions on how we're going to proceed? If not, we'll go ahead and have Ms. Collins give the staff report. Go ahead, Amy.
Good evening, Mayor, Mayor Pro Tem, and council members. Amy Collins, Deputy Director of Human Resources. And I appreciate your time to discuss the city and county attorney process as outlined in the memo and based on the discussions and direction of council. On June 30th, 2020, current city and county attorney Sean Sullivan announced his retirement to be effective by the end of this year. Mayor Quinn, Mayor Pro Tem Castriata, and council requested that Prothman be hired to conduct a nationwide recruitment search. The city and county position was posted on August 20th and closed for first review of applications on September 27th, 2020. 14 applications were received, and of those, 8 applicants were deemed qualified and were moved forward to the work session review with council on October 12th. Council identified the top 3 candidates and interviewed them. Council requested that 3 finalists be invited back for virtual interviews with the city and county manager and deputy city and county attorney. Council requested that 2 of the candidates be interviewed by the city and county attorney's office and department heads. The 3 finalists are Michael Foote, George Hypolite, and Nancy Rogers. A summary of their qualifications are outlined in the memo. The next step of the process is to nominate and subsequently put the nominations to a vote to identify the applicant, which council will make a conditional job offer for someone to serve as the next city and county attorney. City council's options are: number 1, nominate 1 of the finalists, nominate 2 of the finalists, nominate all of the finalists, or nominate none of the finalists and provide direction on next steps. If a finalist is nominated, the next step would be to adopt a motion authorizing the mayor and mayor pro tem to work with staff to make a conditional job offer and negotiate an employment agreement for pay and benefits with the selected applicant. That concludes the staff report.
Thank you. We will now proceed with public comments. If there's anyone who would like to be heard, again, the number is 855-695-3744. Press *3, state your first and last name and neighborhood for the record. We'll go to Kristen. State your name, your full name and neighborhood, and you have 3 minutes.
Hi, this is Kristen Logan. I live in Anthem Highlands. I just wanted to call in today about this attorney search. I think we as a community have gone through a lot over the last several years, and it's not very often when we have someone knocking at our door that actually has the experience working in the arena of making laws, understanding the intent of laws. And for that reason, when I saw Mike Foote was one of our possible applicants, I was extremely excited. I've always admired the work that he's done in the legislature, and I feel like he's always been very fair, upfront, and ethical and honest. He's the type of person that would really lead our city, I think, in a great direction. He understands our community and the issues that we face, not just oil and gas, but looking at Rocky Flats, looking at police reform and criminal justice issues, and like I said, just a full understanding of the law. This really isn't a partisan issue. I know a lot of people automatically assume, based on my oil and gas stance, that I'm a Democrat, but the reality is I was a lifelong Republican who unaffiliated a few years ago. And I did that for various reasons. And I still feel, despite my leanings in different directions on politics, that Mike Foote is the right type of person to lead our community together in a new direction and to be able to provide us insights, ideas, thoughts into the laws. So I really hope that this council supports him tonight and selects him as our next city and county attorney. Thank you for your consideration.
Okay, Lizzie, you're next. State your full name and your neighborhood, and you have 3 minutes.
Lizzie Lario from the Wild-Grass. Oh, can you hear me?
We can.
Okay, Lizzie Lario from the Wild-Grass subdivision. Just wanted to start off with a quick thank you. I know there are so many of you working countless extra hours to deal with the issues impacting our community right now, and I appreciate those time and efforts. I am also calling to speak in support of Mr. Foote being hired as the next city attorney of Broomfield. Mr. Foote would be a tremendous, tremendous asset for Broomfield, especially right now with what we have in front of us. Although not his only strength, he is well-versed in oil and gas, and that is an area we're about to be tested big time from the industry in regard to SB 181 and putting forth our new regulations. It would be naive for anyone to think that oil and gas development is finishing or winding down in Broomfield. Legal battles over local rules and regulations are just beginning, and the industry will be looking to exploit any legal weaknesses. Mr. Foote is the biggest asset and the biggest strength we can have in that department right now. As important as that is, I am fully aware it's not the only issue, nor is it Mr. Foote's only expertise. Looking especially what Broomfield is facing now or in the very near future with police reform in Rocky Flats, as was mentioned earlier, Mr. Foote brings experience and knowledge about both of those issues, which again are very pressing issues in Broomfield. In addition to his expertise and knowledge, Mr. Foote is someone that listens, genuinely cares, and understands the importance of weighing multiple opinions, even when they are opposing. He has hands-on experience as a former legislator. There will be an adjustment for either candidate. However, having worked with City and County of Broomfield in the past, Mr. Foote has more familiarity with the dynamics in Broomfield. He is professional and strong, yet kind and conscientious. As an unaffiliated voter, I greatly appreciate Mr. Foote's ability and experience working with differing opinions to come up with a fair resolution. Please, please make the choice of Mr. Foote, who is a stronger choice for legal representation in Broomfield. Thank you.
Kim, you're next. State your full name, your neighborhood, and you have 3 minutes.
Thank you. Hello, Mayor Quinn and council members. This is Kim McNaughton, Anthem Highlands, Ward 4. So thank you for considering our comments tonight. I definitely agree with Kristen and Lizzie's comments before me because I'm also calling in to convey my support for Mike Foote as choice for the Broomfield City and County Attorney. So I've had the honor to spend time with him in the community and have found him to be a person who really seeks to understand. He's open to new ideas and he's familiar with local government issues. So I've really appreciated his creative thinking, and I've noticed he's adept at working from a bipartisan mindset as well. And he's been very fair and honest in his communication. So with his background in the legislature, it's easy to see where he advocates for his constituents on many varied issues. And yes, he is known, I think, most for his environmental work, but there are also many other issues that he's worked on. And I have a list of those. I sent them not until 5 o'clock, so I don't know if anyone has seen them. I'm probably not going to go through them all right now for the sake of time, but I would just like to close by encouraging you to choose Mr. Foote as Broomfield's next city and county attorney, as I believe he really has a strong capacity to bring a new and fresh perspective to this role. Thank you.
Thank you, Kim. I'm not noting anybody else in the queue. Mayor Pro Tem? No. So there's nobody else in the queue. So the process at this point in time is we'll now open the floor for nominations. and subsequent to the nominations, we'll vote to identify the applicant, which council will make a conditional job offer to serve as the next city county attorney. Are there any nominations from council for the attorney's position? Mayor Pro Tem?
Thank you, Mayor. I would like to nominate Mike Foot.
Councilmember Anderson?
I was just wanting to second that. If you need a second, if not,
I don't think you need a second on the nomination,
Okay, thank you.
but we have one in case we need one. So no, any other nominations? Councilmember Law Evans?
Thank you. Excuse me. Thank you, Mr. Mayor. I'd like to nominate Nancy Rogers, please.
Okay. Are there any other nominations? So I'm trying to look at the process here, because I don't think there's any time for comments here. I mean, I don't think it was put in the script here, but I think now, Sean, it would be the appropriate time to ask for council members, see if they want to offer comments on why they're going to vote for one or the other. But we have two people nominated. We have Nancy Rogers and we have Mike Foot nominated. And I'll now open up the floor to council for if they want to make comments, or we can just move right into the vote for the nomination. Is there any member of council that wants to speak? Please raise your hand. Okay, then I'm going to move. Councilmember Lamb.
Okay, as a council person, my focus is on the candidate's ability to provide legal advice on important city issues. So I evaluated both of the candidates in that regard. In Nancy's supplemental question, she replied that her experience with land use stems mainly from her work on telecommunications issues. That was the extent to which I heard her detail her land use work. Nancy has no elections or county level experience. She stated nothing in the interviews with council or staff about Rocky Flats. The council's unanimous stance in protecting health and safety near Rocky Flats is well known throughout the area. Regarding oil and gas issues, in her interview, Nancy showed that she does not have a basic grasp of the matter. She stated that she sees her role as guiding negotiations with regulatory agencies on these issues. Broomfield's legal challenges are not with regulatory agencies, but with operators. We are immersed in protecting the operator agreement during Extraction's bankruptcy, and our local regulations could be challenged by industry. In her supplemental essay question, she stated it is in this area of oil and gas that Broomfield is seen as a leader and innovator, continually working to find the right balance between drilling and community interests. The only thing that I learned from the examples that Nancy gave is that she's done a lot of work in the last 2 years on public safety issues. Unfortunately, Aurora has had many high-profile public safety issues. I respect that our police department has not engaged in such conduct and that our attorneys have not gained prominence in that area. I have worked with Mike in the state legislature as one of the many grassroots stakeholders. He is approachable and a great listener, affirming the value of everyone's input. He never asked if I was a Democrat. He never made anything partisan, and I am not a Democrat. I am unaffiliated. He had to work 6 years to thread the needle to pass SB 181 and never gave up. When he was attacked by all sides for threading the needle, he always maintained an even temperament and stuck to the facts. When Mike was asked to consult on oil and gas issues, he has always been reasonable. He recognized that Broomfield may still be facing litigation related to Rocky Flats, and he will consider that as part of the public good, as he has worked for his entire career. He cited his work with municipalities as a state legislature as part of his earlier work with municipalities. Regarding the public safety issues in the police bill, Mike stated that he helped consult on 217 and recognizes that it needs refinement in the legislature. So Mike checks all the boxes for the main legal issues that are important to the city. I see Mike as the perfect bridge between council and staff for interpreting the law. Those are my comments. Thank you.
Thank you. Councilmember Hinkle.
Thank you, Mayor. Thanks for the opportunity to speak. I know it's getting late, so I appreciate everyone staying up. I was just pleased that we had 3 amazing candidates, and that I'm also pleased I think we can have the best of both worlds. Going through the rigorous interview process and hearing from all these attorneys and what they had to say was awe-inspiring. Mike with his own attorney practice and legislative work, and Nancy with her municipal work and leading a team through tough situations, as well as George, who's been working for a construction corporation. These decisions are never easy. I do think we should shift our focus and have a strong oil and gas front where we need it the most, perhaps to look to contract with Mike to provide legal guidance in the future in a hands-on type role. All these emails today we received are very true, and I admire the heck out of Mike, just as our community does. And while we know he knows oil and gas laws inside and out, and we see a lot of anxiety in our community over this, and he has policy and litigation skills, and his experience and grit is irreplaceable, he also knows the dirty tricks oil and gas tries to play, and he would be amazing to seek deeper guidance with. It would give him mobility, creativity, and provide the most amount of trust and confidence we have been developing already, and strengthening our systems where it's needed. I can't emphasize this enough, but our situation isn't something we brought on ourselves. We had these wells forced upon us, and we're doing all that we can to protect our residents, and I'm willing to perhaps seek Mike's guidance to help us do what we can to continue to protect our residents. We have a lot of past anxiety, but I also want to realize that we have a new council, it's a new staff, and it's a new day that isn't relying on one city and county attorney role. So I want to take an aerial view of our situation. We've been showing up to nearly all of our oil and gas meetings. I've been pouring in all these hours with other council members as well, hundreds of hours at the Capitol with SB 181. And our council and our community, not necessarily our attorneys, have come up with solutions to our oil and gas issues. And so we don't put all of our faith in one person alone, nor should we. Our noise ordinance, our new robust air quality systems with Dr. Helmig, and our newly developed regulations have had both community and city council input. I have added in a strong health and safety notice idea to be added to our new regs and put forth the idea that we should put the onus on the operator to prove that they need our land to develop the minerals that they desire. This must always be the case, to put the onus on the operator. These are bold ideas, and no offense to our legal team, but they didn't come from our city and county attorney. And I have no doubt Mike's potential guidance could be just as creative and help us with any lawsuits as well, and helping us work on our regs. We've been winning in court, and we've had a strong litigation team who knows full well what council's direction is. So the power to fight oil and gas isn't in one person, it's in all of us. And we've developed enough structure internally on staff, on council, and through the community to keep up this fight. There is literally no wiggle room in this role, no matter who fills it. That being said, for the city and county role, I wanted to be sure I follow the fair processes that all of our council agreed upon. And after 2 intense verbal interview processes, I think Nancy is best equipped for this city and county attorney position. During her interview, she gave detailed descriptions on how she led teams of attorneys and described tough decisions in ways that let me know exactly how she leads a team. I received no indication that she would be oppositional to our approach, and seemed very open to council's direction. She consistently told us she would follow council's direction. I want to remind everyone, especially the public, that Sean has not been the person litigating or in the weeds often with oil and gas issues, and instead focuses on managing a legal team. Nancy has strong municipal experience, and I have no doubt would welcome additional help in local oil and gas issues. These are issues that we have developed strong internal structures for already, and I want to remind the public that this person also needs to oversee water rights, Jefferson Parkway, and more. This decision isn't easy for me. Mike is someone I call a professional friend, as he worked on SB 181 and heard us throughout the whole process. And if he's not hired for a specific attorney role, he would continue to be a friend and ally in this fight to help protect Bloomfield. I have to set aside predispositions, listen to our candidates' interviews. Our overwhelmingly leaning staff feedback was very important to me, and think about what's best for this position, especially during COVID, where we need someone with the experience Nancy has to hit the ground running. Thank you.
Councilmember Anderson.
Thank you. I want to note here that I think this is safe to say that, Mike Foote and Nancy Rogers both naturally rose to the top with this nationwide search that we did. This just happened naturally. And if I want to look at what is best from my perspective as a council member and looking to bring the much needed change that I feel that my constituents need, as we have struggled in the realm of protecting health and safety and some of these biggest issues facing us, that we need proactive leadership and someone that really understands this big picture. And Mike Foote has extensive knowledge. He has been very matter of fact. He's a quick thinker, and he absolutely understands the dynamics of elected officials. This is council's hire. It's our decision. This is the one person that we pick to represent us. And I want someone who is strong on Broomfield's most important issues right now. And for me, and what I'm seeing, I think others can relate to this, is oil and gas, Rocky Flats, and police reform, the SB 217. And Mike Foote has all of that experience. He will hit the ground running. He will be, in my opinion, everything that we are looking for right now, and he will pick up additional experience as we go. He was also a prosecutor. He has a knowledge beyond those areas, and he has shown leadership in his role. And I do want to note that also, as others have said, and I was concerned by some of the emails that were sent in, email in particular, asking us for positions on things. I was previously a lifelong registered Republican. That is how I entered the realm of working with Mike and others. I am currently unaffiliated. This is not a political issue, and I really wish that had never come into this picture. But that's the reality of it. I just want to make sure people are aware of that. And that's really it. I am going to be voting for Mike. Thank you.
Councilmember Jaworski.
Thank you, Mayor. Yeah, this is it has been an incredibly hard decision for me, and it certainly has been a contentious decision, I think, for our city council as well. And I'm not going to disparage, either candidate here. I think they're both great. I love Mike. He's I consider him a good friend, and I've known him for over 20 years. And I think he's a great lawyer. However, I think Nancy is great as well. I've heard a lot. And I've heard that she's well respected. I've heard a lot of great comments from her from a lot of my peers. And I know that she's very well respected in the industry and well regarded. So, that means a lot as well. And for me, it just really came down to that, when I was going into this process, I sort of had in my mind what I was looking for in this position. And it was really someone that had the background in a city and county role. And I was hoping that we'd get a whole lot of candidates in that regard, and we really didn't. But overall, I think Nancy, for me, checked those boxes. I mean, she has been the deputy city attorney for the city of Aurora for a number of years, and she has the management experience that I think that will, really let her sort of jump into this role from the get-go. And I know she has the respect of a lot of our current staff as well. So for me, those are really sort of the kickers and the tiebreakers with this one. I totally agree with Councilmember Henkel. I do respect Mike, and I would love to have him on board still with us in a capacity where he can provide guidance on the oil and gas issues, which are so dear to the heart of a lot of our residents and our city council, and rightfully so. And I think he does provide and can continue to provide guidance and maybe innovative solutions in that area. And maybe some other areas as well has been mentioned. But, ultimately, for me, and I have I guess, when it came down to it, what I was looking for, it was someone that they had the background, that's an experience that Nancy has. So, for the city attorney position, I'm going to support her for that. And I would love to have Mike involved in some kind of additional capacity in the future as well. Thank you.
Councilor or Mayor Pro Tem Castriotto.
Thank you, Mayor. And I do need to make a comment about the you know what I mean? It was politicized, and it shouldn't have been. I mean, if Mike Foote had a political agenda, he would have run for Senate again and won. But he chose to not run again because he truly wants to be of service, and he's been practicing private law before he was a legislator. So I see he brings so much to the table, but yet I also admired a lot of qualities in Nancy Rogers. But to be honest, they're both going to have a learning curve. There's no other place like Broomfield. We're a city and a county. So the only person that's going to be able to come in ready to hit the ground running is someone that worked as the top attorney for a city and a county. There's only one other place like that, and that's Denver. So there's a learning curve for both. And with me, it comes down to relationships and trust. And I believe that the interactions that I've had with Mike, he would give us, cautious advice, but he would be innovative. And he definitely knows what we're going through here in Broomfield. He's connected to Broomfield. And that's important to me. I just don't think the issues in Aurora and the culture there is anything like Broomfield. So again, it's that uniqueness. And I think that having the unique person to fill that job is important to me. I believe that in terms of his management style, we have a very expert team of attorneys in our office that know their jobs. I don't think they need to be micromanaged. And I really wouldn't expect that. It's more of a support position and a resource position. But as far as I've known in the 3 years, we've never denied any extra resources to our attorney's office if they needed outside counsel. So I'm sure that's still the case if they needed more resources, if we needed to grow it. The other thing is he does have a political background, and that is an asset because political acumen is key to dealing with the council. And it's probably been the demise of attorneys in the past not being able to speak the language of an elected official. And that's been my experience. He's an excellent communicator, and he is familiar with Cora, Tabor, open meetings. He's got firsthand experience with all of these things in ethics as an elected official, and including passing a bill that made a change in public records related to Cora requests. Beyond the oil and gas, he's got 18 years of general litigation experience, 16 years as a prosecutor, and the last 2 doing civil litigation. So he has elections law experience. Again, something that the other candidate didn't have. So I do believe it comes down to, what we individually think needs to fill this role. And for me at this time for Broomfield, it is Mike Foote. Thank you.
Councilmember Schaaf.
Thank you, Mayor. So I just wanted to start out by calling attention to my virtual background. It's in honor of Sesame Street. It premiered on PBS on this day in 1969. I've been feeling very Sesame Street lately, and I just wanted to start my comments tonight with a quote. This was from Elmo's dad, and he said, "Not all streets are like Sesame Street. On Sesame Street, we all love and respect one another." And I just, going through this process, I appreciated working with Prothman. I think that was a great decision to go with them. It really kind of streamlined the process, but it also added another kind of objective component to the hiring process. I appreciated the openness and inclusion of all council members and all council members being willing to be involved in this process. I want to give a shout out to the mayor and mayor pro tem for all of your extra work on this. I know that you both put in extra hours, extra days on this process, and I don't want that to be overlooked. I want to thank all the applicants for applying and your interest in the city and county of Broomfield. I appreciate council's extra time dedicated to this matter. And in the end, I truly do believe that we have 2 fine finalists being considered tonight. And I'm happy that they're both interested in Broomfield and I'm delighted that they wanted to have this position here on Broomfield. I think that both candidates bring strengths to this position. Some are similar and some are different. Both candidates will have learning curves for sure. Neither of them have served in Broomfield. Broomfield's a gem of a community. And we're also a demanding community as well. So we have two fine applicants for this position, and I truly do believe that we'd be lucky to have either applicant. I also want to take this moment to recognize our outgoing attorney, Sean Sullivan, for his service to Broomfield. I don't think that we can overlook your dedication for these last couple of years. After our interviews, I got a good picture of both candidates and how they would lead in this role for Broomfield. For me, I'm really looking for someone that will bring creativity, somebody that will bring adaptability, someone who will be forward-looking and pushing the status quo. I think that Mike will do a better job at this, and that's why I'm voting for Mike tonight. Thanks. That's all I have.
Any other questions or comment, or I guess really it's comments. Any other comments? If not, I will call for the roll. And so we have two nominees. We have Mike Foote and Nancy Rogers nominee. When the clerk calls the roll, state who you're voting for, whether it's Mr. Foote or Ms. Rogers. So clerk, please call the roll.
Schaaf,
Mike Foote.
Tessier,
Nancy Rogers.
Anderson,
Mike Foote.
Castriata,
Mike Foote.
Broom,
Ms. Rogers.
Hinkle,
Nancy Rogers.
Jezierski,
Ms. Rogers.
Law Evans,
Nancy Rogers, thank you.
Lim,
Mike Foote.
Lindstedt.
Mr. Foote.
So the vote is tied, and I guess I had suspected that it certainly seemed to be that way for the last week or so. One of the comments I guess I want to say is that I'll put it this way: that first of all, I really respect Mike Foote. I think SB 181 was wonderful legislation, and his diligence in getting it passed was something that we'll always be thankful for in Broomfield and the state of Colorado. Mr. Foote had called me on Friday. You wanted to talk to me, and I decided that I would talk to him. I had never talked to Mr. Foote one-on-one. I'd certainly respected his decisions or the advice he offered when we were talking about the public health order. He did a great service for Broomfield. I would like to see Ms. Rogers, if she accepts the job, because that's the person I'm leaning towards, bring Mr. Foote in to help with oil and gas matters. But what it really got down to me, and I had two or three people that I really considered that I know I respected who recommended Ms. Rogers. One of the things I've learned, because I've been involved with big and small organizations, is the ability to leverage yourself. And one of the things I guess I was impressed with was the fact that Ms. Rogers has been managing a staff equivalent to the size, I think, of ours in Broomfield. When she met with staff, or had the interviews with staff seemed to support her fairly strongly in Broomfield. I think the ability to manage that staff, I don't think you can take it for granted that they're going to operate without the management of the attorney, and that's probably the most significant factor to me. I will point out that I talked to Ms. Rogers on Sunday, and we did talk about Rocky Flats and some of the issues facing Broomfield, because I had not talked to her directly. And Ms. Rogers grew up in Colorado, in Denver, understands the issues on Rocky Flats, understood the issue with the Jefferson Parkway. I'm absolutely convinced that on any of these issues that she's going to consult with and consider counsel to be her client, to understand that you can't just say no to your client. You need to work towards yes, but have them understand the consequences. I'm absolutely convinced she can do that. So I'm going to give the vote to Ms. Rogers, and I'm going to with that said, that she gets the nomination. So therefore, based on that decision, I will entertain a motion to authorize the mayor and mayor pro tem to work with staff to make a conditional job offer and negotiate an employment agreement for pay and benefits with Ms. Rogers. Is there a motion? Councilmember Lyons.
So moved, Mr. Mayor.
Councilmember Jerome.
Second.
Is there any discussion? And once again, this is on making an offer and conditional offer and a negotiated contract. Is there any discussion? Councilmember Schaaf.
Thank you both for your work, your future work on this, and I really hope that Nancy does accept our offer.
Okay. Thank you, Councilmember Schaaf. So I will go ahead and call the roll. Clerk, I won't call the roll. I'll have to ask the clerk to call the roll. It's late.
Tessier?
Yes.
Anderson?
No.
Castriata?
Just to clarify, we're voting on the negotiation part?
Yes.
Mayor, thank you. Yes.
Groom?
Yeah, yes.
Hinkle?
Yes.
Jezierski?
Yes.
Law Evans?
Yes.
Lim?
Yes.
Lindstedt?
Yes.
Schaaf?
Yes.
It passes 9-1. And then Mayor Pro Tem, why don't you and I get together in the morning to talk about how we're going to proceed, and I thank everybody. Once again, I'm going to note for the record here that we had a really good discussion in executive session, and once again, another council meeting in which I really respect how council deliberated, and we'll, the Mayor Pro Tem and I'll be reporting back to council throughout the next week. The goal is to vote on the contract next Tuesday, and we will keep, I guarantee you, we will keep council apprised of what happens during this next week. The next step for me will be to talk to Mayor Pro Tem in the morning, and then to the attorney about the contract. He's already given us a draft contract. So we have one other item tonight, and I know it's past every deadline ever set by council, but it is an executive session that the attorney has been wanting to do. So let's go ahead and move on that. And this is the council's consideration of a request for an executive session for legal advice and direction to negotiators regarding a lawsuit. I guess it says we'll take a public comment on this. I'm not sure what they can comment on, but I'm not noting any public comment. So I get, well, I'm a little, I guess Sean he'll talk about it when he gives the recommendation. So this is to have there's a lawsuit that's pending, and so are there any comments or questions from council on having this executive session, which would be held on Thursday, which is a special meeting after our special meeting. So I'm noting none of that. So request for the executive session require an affirmative vote of 2/3 of the quorum present. Will the city and county attorney please read the recommended motion?
That an executive session be held on November 12th, 2020, following the special city council meeting for legal advice and to direct negotiators regarding HN XREL AN, a minor, versus City and County of Broomfield, as permitted by section 24.6.4024B and E of the Colorado Revised Statutes.
Councilmember Schaaf?
So moved.
Councilmember or Mayor Pro Tem Castriota?
Second.
Is there any discussion? Will the clerk please call the roll?
Anderson?
Yes.
Castriata?
Yes.
Groom?
Yes.
Hinkle?
Yes.
Jezierski?
Yes.
Law Evans?
Yes.
Lim?
Yes.
Lindstedt?
Yes.
Schaaf?
Yes.
Tessier?
Yes.
It passes unanimously. The city and county attorney's report is next. Mr. Sullivan, do you have to report? You have a report?
Just a couple of items for council's consideration. Today, Extraction Oil and Gas filed its notice of appeal of its convictions in the noise case for the 7 noise citations that we were issued. So that appeal will be heard by the Broomfield District Court, and we'll keep you apprised as that case progresses. With regard to Extraction's bankruptcy, there were a couple of things pending and that went on last week. As you will recall, there was Extraction tried to reject some of its midstream contracts, including Elevation's midstream contract, and Elevations is a pipeline company that operates the pipelines within Broomfield. The parties, before the judge issued a decision, the parties announced that they had reached a settlement that will be filed with the court in early December that will allow Extraction to continue to use Elevation pipelines. They acknowledged in their disclosure statement that without the pipelines, they don't have an ability to move oil and gas within Broomfield. They also filed last week and got approved by the bankruptcy court their disclosure statement. That will be sent out to their creditors for vote starting this Friday. December 4th, they have to file a supplemental bankruptcy plan, and that'll include the contracts that they're going to negotiate. And we're going to have more discussion with City Council about the status of the bankruptcy proceeding in executive session on Thursday. That's my report. Thank you, Mayor.
Any questions or comments of the Sean? We'll move on to Jennifer. Jennifer, do you have a report?
No, I do not.
So we will move on. There is no legislative update. There is no business before the Broomfield Urban Renewal Authority or the Arista Local Improvement District Board of Directors. Additionally, there are no special reports or requests for future action. So this concludes the items on this evening's agenda. Is there any other business to come before council? Noting none, there be no further business. The council meeting is adjourned. Thank you.
Good night.